All right. Good morning, everybody, and welcome. Thank you all for being here and for your commitment to advancing solutions through the FDA's Patient Drug Development Program. My name is Bryn Kerrigan, and I have the privilege of serving as the Director of Kern County Public Health. In Kern County, valley fever is not an abstract public health issue. Kern County consistently has the highest number of valley fever cases in the state of California and the second highest number of cases in the nation. It is part of our daily reality here in Kern County, and each year thousands of our residents are diagnosed with this disease. Our families live, work, and play in an environment where exposure is a constant risk. At Kern County Public Health, we see the impact of this disease from many angles. Our public health lab is one of only 4 labs in the nation that performs specialized valley fever testing, supporting clinicians and patients not only in our county, but across the country. Our disease control staff receive and monitor every positive valley fever lab result for Kern County residents. Our epidemiology team conducts surveillance and provides critical data to inform our community and guide public health action. And our marketing and communication team works to raise public awareness and educate our residents about the prevalence of this disease in new and creative ways. But today, I also speak from a deeply personal perspective. Despite serving as the director of Kern County Public Health, spending years educating our community about valley fever, and working closely with hospitals and healthcare providers throughout our region, my own diagnosis with Cocci Meningitis was a journey that was anything but straightforward. 2 years ago, I was practically bedridden with no idea what was wrong with me. I was bouncing between my primary care doctor, urgent care, and emergency rooms, trying to understand why I was suffering from debilitating headaches, sensitivity to light, nausea, vomiting, and overwhelming fatigue. I was told they were tension headaches, that I should go get a massage. I was told I was dehydrated and just needed fluids. Tests were ordered, but a valley fever test was never one of them. On my 5th trip for care, nearly a month after my symptoms began, I was finally taken seriously, and a lumbar puncture was performed. On May 2nd, 2024, the results came back: Cocci Meningitis. I was started on 1,200 milligrams of fluconazole per day. My meningitis symptoms subsided almost immediately, but the side effects from the medication, they started to take effect. Hair loss by the handful, severe dry skin, cotton mouth. After a few months, I barely recognized myself when I looked in the mirror. It's easy to understand why some patients stop taking their medication. When the illness symptoms improve, but the side effects drastically affect your quality of life, the decision can become an incredibly difficult one. In September of 2024, I failed on my medication and my meningitis symptoms returned. I spent another week in the hospital and was able to switch to a different treatment option. I was put on 400 milligrams of posaconazole per day. Posaconazole was a game changer for me. My symptoms and my side effects completely went away. In November of 2025, my health insurance provider began to deny covering posaconazole. I couldn't understand how they can do that, given that my infectious disease doctor had determined it was the best way to treat my disease. So I approached my pharmacy about being a cash pay customer. $7,559 per month. No wonder my insurance company wasn't willing to cover it anymore. Fast forward to today, and even though I gratefully stand before you feeling like my pre-Cocci meningitis self, my journey with valley fever isn't over. In fact, it will never be over. I am reminded of the disease that has made my body its permanent home every morning at 7 a.m. when my medication reminder goes off on my phone. Medication that I depend on to stay alive. And my story is only one of many that we'll get to hear today. Our stories and our experiences, they matter, and they can pave the future for valley fever and Cocci meningitis treatment. On behalf of the many individuals and families impacted by valley fever and Cocci meningitis, thank you for being here and for being a part of this important conversation and for bravely sharing your vulnerable health journey.
And now I would like to introduce Dr. Peter Kim from the FDA, who's going to be providing some opening remarks from the FDA. Thank you, Brent.
Thank you. Hello, my name is Peter Kim, and I am the Director of the Division of Anti-Infectives in the Office of Infectious Diseases, Office of New Drugs, Center for Drug Evaluation and Research, US FDA. I'm happy to see so many patients, caregivers, and advocates attending this patient-focused drug development meeting for disseminated coccidioidomycosis with central nervous system involvement, including meningitis, also referred to as CNS disseminated coccidioidomycosis. Thank you all for being part of this meeting and for sharing your experiences with us. I would also like to thank the Mycology Advocacy, Research, and Education, MyCARE Foundation, and all of the staff that were involved in planning this meeting. I know we also have representation from industry, academia, and other medical product development stakeholders. While FDA plays a critical role in medical product development, we are just one part of the process, and I am glad to see a high level of interest from those of you who also play an important role. We are truly looking forward to hearing the lived experiences of patients and their caregivers managing CNS disseminated coccidioidomycosis. We particularly want to hear about the symptoms, functional limitations, and treatment burdens that most significantly impact daily life associated with this serious and potentially lifelong devastating disease. This information will help us work towards the development of patient-prioritized outcomes for future drug product development and regulatory decision-making. Currently, the standard of care treatments for coccidioidomycosis are azole antifungal drugs, such as fluconazole, itraconazole, voriconazole, posaconazole, and isavuconazonium, used off-label for this purpose. Adverse effects with these drugs are relatively common and can impact patient adherence and may therefore limit the utility of the drugs. The two FDA-approved treatments for coccidioidomycosis, amphotericin B and ketoconazole, are associated with serious adverse effects. Amphotericin B is used primarily to treat severe disease as rescue treatment or when azoles are contraindicated, for example, during pregnancy. Although approved, ketoconazole is rarely used at present for the treatment of coccidioidomycosis, largely owing to considerations related to side effects compared to other azoles. Disseminated coccidioidomycosis requires aggressive and lengthy treatment. Coccidioidal meningitis is universally fatal if untreated, and relapse after treatment discontinuation is common. Therefore, therapy for meningitis is typically lifelong. While FDA plays a critical role in medical product development, we are just one part of the process. These meetings give FDA and other key stakeholders, including medical product developers, healthcare providers, and federal partners, an important opportunity to hear directly from patients, their families, caregivers, and patient advocates about the symptoms that matter most to them, the impact the disease has on patients' daily lives, and patients' experiences with currently available treatments. We would like to hear what specific things patients look for in an ideal treatment to manage their condition. This will help inform the focus of new drug development and future clinical trials. FDA shares the patient community's commitment to facilitate the development of safe and effective medical products for CNS disseminated coccidioidomycosis. FDA protects and promotes public health by evaluating the safety, effectiveness, and quality of new products, but we do not develop medical products or conduct clinical trials. It is, however, FDA's responsibility to ensure that the benefits of a product outweigh its risks. Therefore, having this kind of dialogue is extremely valuable to us because hearing what patients care about can help us lead the way in figuring out how best to facilitate medical product development for CNS disseminated coccidioidomycosis and understand how patients view the benefits and risks of their therapies. We look forward to incorporating what we learned today into the agency's thinking and understanding of how patients view benefits and risks of therapies for this disease. Your input and perspectives really help us and will help industry and academia to move the drug development process forward to ensure that new medications meet the needs of people living with CNS disseminated coccidioidomycosis. Once again, we are here today to hear the voice of the patient. So thank you for your participation. We are grateful to each of you for being here and sharing your personal stories, experiences, and perspectives. Thank you.
Thank you, Dr. Kim. My name is Rob Purdy. I'm also a Cocci Meningitis patient and co-moderator, along with Bryn Kerrigan. I'm going to introduce the next speaker, but as we do that, I also want to introduce one of the ways that we'll be connecting with you, and that is through polling questions. So the first polling question is being launched now, and that's just where we learn about who you are and your relationship to Cocci. There will be many other questions and polls that are launched, and we ask you to please answer them if you can. Some are specific to patients and caregivers, and some are more broad. Next, to introduce the clinical aspects of valley fever or coccidioidomycosis, and I also want to comment how impressed I am that Dr. Kim was able to get that right. Many people do mispronounce it. I have the pleasure to introduce Dr. Gita Suvasubramanian from UCSF Fresno, an amazing clinician, an amazing colleague, and I would even say a friend. So please give us an overview of Cocci Meningitis.
Thank you, Rob. Thank you for having me here. I'll kick this off with Cocci Meningitis presentation, but I'm going to keep it very short because, again, we want to hear from our patients and their experiences. Are you able to see my slide all right?
Not yet. Did you share your screen?
I did, yes.
Okay, so we will need to take our slides down, and then we can put yours on.
How about now?
Not yet. This is everybody's favorite game in virtual meetings now is, can you see my slides yet? If we don't get them up here in the next 30 seconds or so, maybe we can just have you go, and then you can send me the deck and we can add it back in. Oh, there it is. Yes.
You see
Although
now?
it is in presenter view. But it is in presenter view. Yeah.
How about now?
There you go. Perfect.
All right. Thank you so much. Yeah, so I'll keep this very short. Most of you here in the audience are familiar with Cocci Meningitis, but I just want to kickstart with some of the clinical aspects of this so we can then hear from our patients and caregivers. So as you all know, coccidioidomycosis is caused by coccidioides, a fungus that's a shape-shifting fungus, causes infection by inhalation of the spores, very endemic to Central California and Arizona. You can see the map there, but the areas where it is endemic is expanding. The fungus is in a spore form under the soil and can sporulate and be inhaled into the lungs and cause initial lung infection. But it doesn't stop there. Even though meningitis is rare, it is the most lethal complication of coccidioidomycosis. And as we already heard, untreated coccidioidomycosis is fatal. So, what are some of the risk factors? Some studies have shown that male sex definitely has a higher preponderance for disseminated cocci, especially meningitis. Seems to be a racial predilection for Filipino and folks of African American ancestry to develop more disseminated infection. Pregnancy, especially third trimester, seems to be a big risk factor. Other conditions that may suppress your immune system, such as being on high dose of corticosteroids for any other condition, solid organ transplant recipients, patients who are needing some of our newer biologic therapies, HIV infection, especially if your CD4 T cell count is lower than 250, or any condition or genetic factors that may influence your immune system. Having said that, unfortunately, we do see completely healthy patients develop disseminated cocci and cocci meningitis all the time, even though there are some known risk factors such as these here. So how does it spread to the brain? Cocci starts in the lung. We inhale the spores into the lung, and then through the bloodstream, it penetrates the CNS and invades the meninges, which are the covering around the brain. And it seems to affect this lower part of the brain called the basilar meninges. And the inflammation that is caused by the infection leads to significant blockage of the flow of cerebrospinal fluid, which cushions the brain. And this leads to enlargement of all the ventricles, and hence the concern that the high pressure could cause herniation and death if untreated. Central nervous system infection usually occurs fairly early in the course of infection, usually within weeks to months after primary infection. Occasionally, if somebody has been treated with antifungal treatment for their primary infection, the CNS infection may happen later, after 1 to 2 years, or even longer after the initial infection. But for the most part, especially those that have not been treated with antifungals before, the CNS infection seems to happen fairly early in the course of infection. It's also important to know that by the time someone has had meningitis, they may not have any lung symptoms, or they may have very few lung symptoms, and they may have a normal chest x-ray. This is one of the reasons why the headaches associated with meningitis are not associated with cocci, is because they don't have the concurrent lung symptoms that goes along with that. About 50% of patients who do have cocci meningitis may have other lesions outside of the lungs as well, such as skin or bones, also resulting from the bloodstream transmission of the fungus. Of course, the most common symptom is headache. It starts fairly slowly. It's often insidious, but continues to progress. It's important to know that when primary lung infection happens with cocci, headaches are fairly common in that situation as well. So sometimes for us as clinicians, it becomes hard to differentiate the headaches from the lung infection to whether the headaches is actually from cocci meningitis. So if it becomes harder to differentiate, a spinal fluid test would be necessary to rule out cocci meningitis. Family members typically notice as the headaches progress, they start to notice the cognitive dysfunction, which may present as personality changes, emotional lability, or mild confusion. As the infection progresses and as the inflammation progresses, they may then further have gait disturbances, change in vision, diplopia, change in confusion and disorientation, lethargy, and may progress on to stupor if hydrocephalus has occurred. And I'll mention briefly what hydrocephalus is. So what are some of the red flag signs when somebody has headaches? And the story that Bryn shared, we see that often with many of our patients where they come into urgent cares with headaches and they're told that they have migraines, or they are dehydrated, or they have a viral infection. But when the headache persists and doesn't go away and continues to progress and worsen, there's unusual severity, associated nausea, vomiting, blurring of vision, any change in mental status, change in personality, gait disturbances. These should all be red flag signs that should alert in an endemic area, even without concurrent lung symptoms that the patient may be having cocci meningitis. Unfortunately, the objective findings, at least in the beginning, are very less. There's quite a bit of positive findings. It's rare to see nuchal rigidity. The only findings we may see are some slowed speech or cognitive dysfunction, especially early during the course of infection. However, if we do a blood test for cocci, a positive serum cocci antibody test is almost always present in patients with cocci meningitis. And again, if the suspicion is fairly high, we always recommend repeating the Cocci test if in the initial phases the test happens to be negative, especially if your immune system is weak. We do recommend all patients with Cocci meningitis get a neuroimaging test done. MRI is the preferred modality, although a CT scan may be helpful. But MRI is able to show the meningeal inflammation if that's present. It may show strokes. And in patients who have developed complications because of the obstruction of flow of the cerebrospinal fluid, it may show dilatations of the ventricles or hydrocephalus. It's important to know that if you do not have headaches or if you do not have other CNS diseases, signs, symptoms, then that has a pretty good input or negative predictive value in that these patients do not routinely need a spinal fluid test done. So not all patients with Cocci need a spinal fluid test done, especially if they don't have a headache or any signs or symptoms of CNS disease. If Cocci meningitis is suspected, a spinal fluid should be obtained for analysis after neuroimaging. And an opening pressure should always be measured in these cases, and an elevated pressure suggests that the patient has developed hydrocephalus. Usually, the spinal fluid will show an elevated cell count, and it will show low glucose and high protein levels. Then we do send out these special studies from the spinal fluid to test for Cocci, and we recommend multimodal testing approach because not one test is perfect. Some of the tests that we send from the spinal fluid are the CSF antibody testing. Complement fixation and immunodiffusion are the mainstays of diagnosis, which measures the IgG antibody in CSF. These are highly specific when positive. The sensitivity may be imperfect, and a negative test result does not rule out the disease. CSF antigen testing detects Coccidioides galactomannan antigen. It has excellent specificity. Useful adjunct when antibody testing is negative in the early phases. It is becoming increasingly available at several reference laboratories. The culture of spinal fluid is positive in a minority of cases. It has low sensitivity, but when it is positive, it's very helpful in diagnostic, but it also requires special lab procedures and requires a biosafety level 3 precautions. We directly visualizing the fungus is rarely positive in the CSF. If we do identify spherules, which are the fungal structures under the microscope, they are very pathognomonic for Cocci meningitis. A PCR testing is commercially available at some reference labs, but it has limited sensitivity. But when positive, it can provide a rapid diagnosis. So no one test is perfect. We use multiple tests to identify this. All patients with Cocci meningitis should receive antifungal treatment. Untreated Cocci meningitis is universally fatal, and most patients who are treated with fluconazole survive, but lifelong therapy is necessary to prevent relapse. And fluconazole is the preferred agent now due to its excellent CNS penetration. Adult dosing usually runs between 800 to 1200 milligrams daily. IV amphotericin B alone is ineffective due to its poor CNS penetration. The alternative azoles are itraconazole, which is the alternative first line. We use either voriconazole, posaconazole, or isovoconazole for refractory cases. Intrathecal amphotericin B is reserved for refractory disease or for when other options are not available, such as during pregnancy, and reserved for azole failures. It requires administration by experienced practitioners, but currently it's the only known potentially curative option. There are several complications that can happen from Cocci meningitis, the most common being hydrocephalus, which is the blockage of the flow of cerebrospinal fluids, leading to dilatation of the ventricles, and if not controlled and the pressure is not controlled, can lead to herniation and can be fatal. The other complications, as you can see here, are vasculitis or inflammation of the blood vessels causing strokes. And patients can also develop complications in their spinal cord called spinal arachnoiditis, which is because of the inflammation of the meninges causing adhesion of the nerve roots. So this can, in addition to the other complications, can cause back pain, paralysis, tingling, numbness, bladder or bowel dysfunction as well. Hydrocephalus is the most common complication, results from the basilar meningeal inflammation. It can cause obstruction to the CSF flow and impaired absorption. And again, it can develop at presentation or can develop later during treatment as well. Oftentimes, a CSF shunting procedure is required, such as a ventriculoperitoneal shunt placement. And unfortunately, some patients require multiple shunt revisions and go through complications of this. I'm going to stop here to talk about the clinical aspects, and we'll hear how this affects our patients now. Thank you.
Thank you very much. We appreciate you sharing all this information. It's great. And as one of the participants already asked, they're hoping that you'll allow us to share your slide deck on the website, on our website. I think it's great for patients to have that aspect. So next up, I'm going to put our slide deck back up so that I'm going to ask our technical person to talk a little bit about how today will work. So we're going to have panel facilitated discussions with audience participation. So what does that mean? That means the patients are going to lead each topic, and throughout this, in addition to the chat and Q&A, there will be polling that will be placed up. That's your opportunity to give us your insights, and we're going to use that to inform conversations that are going to happen later on. So although patients who are not on our panels won't be speaking, you will be heard, and there will also be surveys and other things after this that you'll be able to engage on. So please use the Q&A, the chat, and the polling to help us better understand some of your experiences and incorporate them. Again, this is obviously being recorded. Please feel free to participate as much as you would like. And we have one break scheduled about halfway through. And please, again, this is a patient meeting. The goal is to have patients participate. We have patients and caregivers on the panels. We want your experience. So next up will be topic 1, health effects and daily impacts. And we're going to talk a little bit about this. As you can see, we are just a few minutes behind. So I'm going to invite some folks to join our panel discussion. And as you join, I'm going to ask you to briefly, in 3 to 5 minutes, tell us a little bit about who you are. You don't have to share your name. You don't have to share anything you don't want to. But tell us a little bit about, who you are as a person and your connection to Cocci Meningitis. And then from there, we'll get into a discussion that will be led by my co-moderator, Bryn, and myself. So first would be Neil Meeks.
Good morning.
Morning, Neil.
All right. Happy to join you guys. I'm here at the happiest place on earth, actually. So thanks for letting me get done a little early in case I need to go out. We're at Disneyland. So, all right. So back in 2016, I had a 2-year-old and a 2-month-old at the time to kind of set the stage on my journey. I found myself with some severe back pain all of a sudden, and I thought I'd tough it out. So about 2-3 days went by, and I'm trying to tough it out. And, one day after work, my wife looks at me and she's like, "Man, you look different. You should probably go to urgent care." So I go to the urgent care, and they're testing me, and all of a sudden they're hooking up all the heart monitors and everything. And this doctor comes in, and I'm 38 at this point in time. And this doctor comes in and he looks at me and he's like, "Dude," the doctor's probably like my age, but he could have been younger at this point in my life. He said, "Hey, what's going on with you? We're sending you to the hospital right now via ambulance." And I was like, "Wow, wait a minute. I've never been in an ambulance. I've never been sick. I'm 38 years old. I'm healthy. I don't smoke. I don't do anything. Like, what's going on here?" And he said, "Well, something's wrong with your heart. Your blood pressure is super high. Your heart rate's high. We don't know what's going on here. So you're going to the heart hospital." So thank goodness I do have some friends in the community. I called my doctor. Thank gosh he answered the phone. He was actually in San Francisco at an event in a club, and he took my phone call. And he said, "Neil, why are you calling me at 10 o'clock at night?" And he said, "You need to go to the heart hospital." I give him the rundown. "You go to the heart hospital. I'll make a phone call." So I get in there, and I'm not even done pulling my paperwork, and they call me in. So they come in and run all these tests, and like, "Oh, you have pneumonia." "Oh, That makes sense. Back, your lung. Okay, pneumonia. They treat me for pneumonia, send me on my way. 20 days later, I'm back in my doctor's office, and I'm not right. The headache has started. Just all the symptoms are starting to form up right now, right? The headaches, the pain, the joint pain, all these things. So I go to my doctor's office, and he says, "Hey," and I think you have meningitis. And he had been trained under Dr. Einstein here in Kern County, so he was familiar. He's diagnosed me in the office, and he said, "I think you have meningitis, and it's probably from valley fever." What is valley fever? I'm from here. I'm immune to it, right? As we're all told. Oh, you're from Bakersfield? Valley fever, schmally fever, like that won't affect you. Well, does. So I go to the hospital again, and they test me for valley fever. Negative. Oh, must be something else. So, which is probably somewhat common to get some, false negatives. So they kind of go through the thing. They keep looking at my legs, looking at my feet. They just can't figure it out. Maybe it's Lyme disease. Maybe it's all these other things. So a couple days as I'm in the hospital, a couple more days. By the way, I'm on Dilaudid, and I'm taking Dilaudid every 4 hours, and what is the Vicodin, the other Vicodin, Norco, every 4 hours as well. So every 2 hours, I'm taking some type of drug, and I'm pretty out of it. So finally, I think by the third test, I get my valley fever diagnosis. It finally came back positive. So I had 2 false negatives. So then kind of scrambling, what's going to happen? So they start me on 1,000 milligram fluconazole, and my symptoms are, my titer count's getting higher. It's getting higher, and I think it topped out at 64. I think is what it was, if that's the number I can remember. And at some point, the doctors, this is kind of weird for me to remember because I have a lot of blank reel anymore. And so they say, "Hey, we can't stop the meningitis right now. Something's going on. We just can't stop it. It looks like we are going to have to drill a hole in your head to relieve the pressure, and then have it drained from a tube into your stomach." And when you're basically told that, and you're thinking, I've got a young 2-year-old and a 2-month-old. My answer was, yeah, that sounds great. I'm going to do that. Go ahead. Let's move forward on doing that. And right before that, they go, but let's do a spinal tap first. Oh, doesn't sound any better, but okay, let's do that. Again, this is my first trip to the hospital too. I've never been in the hospital. I haven't broken a bone. I haven't had stitches. I'm one of these guys. So spinal tap sounds like the absolute worst thing that could ever happen. So I do that, but I'm on Dilaudid, so the first one's not that bad. So I go in there, and the fact that so much pressure came out when they actually did the lumbar punch, that they said, "Hey, we're going to hold off on this drill a hole in your head procedure. Let's see where this goes." So after the pressure release, and I'm sure it was all by chance, everything kind of started to slow down. The meningitis started to slow. They're able to start kind of reversing that out. The fluconazole, my body responded very well to it. So 3-4 more days go by. I have another one. The pressure is lower. That's what they were looking for. They were looking for that initial pressure. That lowers down. And so after about 2.5 weeks, I'm released from the hospital. I go home. I'm on 1,000 milligrams fluconazole. And for the next 5.5 years, I struggle with all the symptoms of fluconazole. The hair loss, the I typically weigh about 230 pounds. I'm 6'3". When I walked out of that hospital, I weighed 168 pounds. So eating just wasn't fun. Didn't want to eat. Didn't want to do anything physical. My strength just disappeared. I was kind of gray. I was gray for 2 years, at least. And so about 5.5, almost 6 years go by. I haven't had any like, meningitis symptoms or anything like that. I decided I can't do this anymore. And I weaned myself off. So about 3 or 4 months, and against any of my doctor's wishes, by the way. It wasn't, my doctor is a friend and even told me, you know what, as your doctor, absolutely not, we're not doing that. And as your friend, probably shouldn't do it, dude. I did it anyways. So I've been off my meds for about 3.5, 4 years now. And it was a risk. I knew it was a risk, but I kind of weaned it off. I dropped down from taking 1,000 to like 600, and 600 dropped down to 300 or 400, whatever it was, and then eventually I quit taking it. So my body, I felt like it was okay to do that. I did watch it. I mean, it was over a 4 to 6 month period that I weaned myself off of it. So I haven't had a checkup, honestly, in 2 years. I'm back to my normal weight, my normal size, probably even more so than I need to be. But all of my other symptoms and everything have disappeared. I'm able to go to the gym. I'm able to do things. I'm able to, live a normal life. And I know I'm probably on the rare side of that. But it does happen. I have zero Cocci meningitis symptoms anymore. And that's
Neil,
my story.
And you are actually one of only 2 patients I know who has actually successfully discontinued medication, and obviously not something that's often discussed or even incentivized, and it shouldn't be. But,
right.
I thought your voice was important to include for that very reason. And so I thank you, and I'm going to invite our next person up to give again, we want to try and keep these to 3 to 5 minutes so that we can get everybody in, and then we're going to discuss it more. You have a very unique path to diagnosis. So next is going to be Elijah, and he's going to give us a kind of an overview of his path. Elijah.
Can you hear me? Hello. Hi. So my name is Elijah. I got diagnosed with valley fever in 2016. So give you a quick synopsis. I tell this story a lot, but when I was 17, I was a senior in high school. My family had moved to Florida, and we moved to Tallahassee, Florida, and I was really healthy. I was an athlete. I was really active. I had a good social life. I moved here my senior year. I moved here in 2015, and I had a history of asthma, and I had an issue with some lung things going on, and so I was no one new to lung problems. And then I also wrestled in high school, so I frequently cut weight, and I honestly just kind of destroyed my body just to be an athlete. But I got really sick towards the end of my wrestling career, my senior year. And so the beginning of the year, so January 2016, February 2016. And then I went to state and I couldn't compete. I was really, really sick at the time. And then when I came back home, I had just kept on missing school. And my coach was like, he needs to go to the hospital. And I continuously kept going to the ER, and I kept going to the doctor. And I got treated for a sinus infection. I got treated for all other types of they gave me a Z-Pack. I got all types of antibiotics. They referred me to a bunch of surgeons. A bunch of surgeons said that there was nothing wrong with me, that I was faking my illnesses, my sicknesses, that I just didn't want to go to school. But I was a really good student. And I was suffering from like headaches and like nausea and fatigue and just like really bad migraines that like I had never experienced before. Like I never was in someone that never experienced headaches. And then finally we went to the ER one Saturday or Sunday night, and I just was like in my room. I couldn't move. I couldn't do anything. I didn't want TV on, no the lights. They wouldn't talk to me. And then I went to the ER, and then my mom was like, "We're not leaving until you figure out what's wrong with my kid because he's not faking this." And then finally, the ER doctor had performed a lumbar puncture, and from the lumbar puncture, he was like, you have meningitis. He's like, your white blood cell count was like 800 something. And so he's like, it's bad. And he's like, do you definitively have meningitis? So they admitted me to the hospital. I was in the hospital. They were like, we think that it's viral meningitis. That sucks. It'll go away, whatever. So then they were like, but we can't do anything about it. It's like the flu. You just get better. And then I wasn't getting better after a couple of days. So then they were like, we think it's bacterial meningitis. So they were like, and because of how sick you are, you're probably going to die. And like, we just can't do anything about it. So they were still continue to treat me in the hospital with precautions. And then I was getting worse, but obviously I didn't die. So they were like, we think it's partially treated bacterial meningitis is like what we're thinking. So they kept running tests. And then I had a stroke in the hospital. When I had my stroke in the hospital, they didn't know what to do with me. So they offered to put me in hospice. They told my family that was the only option for me, that there was nothing they could do for me. There was no chance of me having any sort of survival. So they tried to put me in hospice. Because we had just moved to Tallahassee, we didn't know what to do. And we just kind of hoped that like the local physicians are going to save your lives. So my mom had just reached out to a bunch of our coworkers, and somebody had said that we should transfer to Wolfson's Children's Hospital in Jacksonville because they have much better healthcare out there. So we did. We transferred to a different hospital in Jacksonville, Florida. I was in a coma for a little bit, for a few days. And then they tried to bring a helicopter to come like rescue me, but the weather was too bad. So they had to take me by ICU bus. So like really cool little ambulance. They took me out there. Then I woke up a few days later from the coma. They had declared me like brain dead, and they were like, there's really nothing we can do. But my mom was like, I know that there's life still in him, that he's going to wake up. And so, I can't remember what had happened. My mom like grabbed my hand and was like, and while I was in the coma, like asked me to basically show some sign that I was awake. And I squeezed her hand when I was in the coma, and they were like, that's enough for us to keep trying. And then I woke up a few days later. I couldn't walk, I couldn't talk, I couldn't move, I couldn't do anything. I remember it was the craziest experience for me because I remember like wanting to communicate with my family and knowing everything I wanted to say and everything I wanted to do, but I couldn't do any of those things. So they started doing therapy with me right away at a feeding tube. I did physical therapy, occupational therapy, speech therapy. I did music therapy. I did like all the modalities. I went to rehab for a little bit, and then I got septic. So I ended up having to go back to the hospital. I went back to the hospital, then I got better, and then they discharged me. And then when I went home, I had another stroke, and I turned 18. So I went home May 1st, and then I turned 18 May 5th. And then I had a stroke on Mother's Day, which was May 7th. And then I went back to the hospital, and Wilson said they couldn't treat me anymore because I was an adult. I was legally a legal adult. So I got transferred to the adult side, which was Baptist. And then the sepsis came back. I went into kidney failure. All my organs started shutting down. I ended up back in the ICU, the neuro ICU. They performed a bunch of tests, a bunch of scans, a bunch of things. They had physicians come from Johns Hopkins and from Mayo Clinic that were trying to treat me, but they didn't know what to do. So then my mom was like, you guys are doing everything you can. What do we do? Like, what's our next step? And they were like, you need to go to Johns Hopkins or you need to go to Mayo. But Mayo Clinic didn't take our insurance, and Johns Hopkins was just really, really far. So so my primary care physician back in Tallahassee, he did his medical residency at Emory in Atlanta. So they recommended that I went to Emory. So I went to Emory in Atlanta. And when I got to Emory, I was there for maybe like 2 weeks. And before they finally figured out, they were like, this has to be a fungal infection. And they finally tested my cerebrospinal fluid for antibodies for coccidioidomycosis. And they determined that that's what I had. It was valley fever. And they were like, we're just going to put you on fluconazole. I did amphotericin. I've only taken fluconazole and amphotericin B, the amphoterrible. And the ampho, I did a bunch of rounds. I did like maybe a week there. I was awful, losing my hair, dry skin, vomiting. Then I got discharged in the hospital. I still couldn't walk. And then I felt like my fluconazole medication, I was taking like, I think like 1,600 milligrams a day or something. I was taking a lot. And I said, I don't feel like this is working. So I stopped taking it in the winter, the end of the year in 2016. And then I ended up back in the hospital in 2017. I had hydrocephalus. I had to have a shunt placed in 2017. Then my shunt failed in 2019. I had to have it revised twice in 2019. And then I was complaining of back pain and realized that my back hurt. And when they performed an MRI, they determined that I had like arachnoid cystic formations forming along my spine. So I have like these cysts that form in my spine. So in 2020, I had to have a laminectomy, which is basically like they cut into your spine and then remove parts of your spine and then cut out all the little cysts in my thoracic spine, T4 to T6. Then I was complaining of the same issues. Had to have another laminectomy in C1 and C2, like on my neck. And then I had another problem again. So that was in 2020, 2021. And then I had the same problem. One day my arms just kind of went numb and I just couldn't use them anymore. And I wasn't able to walk. It was the craziest thing. And so I went back to my doctor and I was like, hey, something's wrong with me. And they were like, yeah, you need to have surgery on your spine again. So then I had surgery on my spine again in 2024 in January. And because of that, the complications from that surgery, my shunt failed. And then, so because my shunt failed, I busted open the stitches in the back of my neck. And, so I had to have my shunt replaced. So I had to have surgery on my spine in 2024, my shunt replaced, and then surgery again. And, I have and then that's just now it's my ongoing battle of when am I going to have surgery on my spine again? And when am I going to have revisions on my shunt? And, I just my biggest issues is I have left-sided weakness and deficits on my left side. And I have nerve damage to my left foot and makes it difficult to ambulate and get around and do things. But, yeah. That's basically my story.
Thank you. And that's a lot to cram into a few minutes. How old are you now?
I'm 27.
So this is in less than 10 years. That was the 10-year history of your life with Cocci.
Yeah.
That was, I can't say impressive, but it's, thank you. Thank you,
Of
Elijah.
course.
And I know you have to get out and then hopefully you'll get back in, but I wanted to make sure you had an opportunity to share your story. So next is going to be Jessica. So we'll put Jessica on screen. Hi, Jessica. And just ask you to kind of briefly tell us a little bit about your experience with Cocci meningitis.
Definitely. Can you hear me all right?
Mm-hmm.
Awesome. Hi, everyone. I am Jessica Beater. I have a bit of a shorter history. It's more of within the last couple years development in my life. Back in late 2023, I was in my third trimester of pregnancy with my second child. I live in the Paso Robles, California area, a little bit west of the Kern County area that's been talked about. Anyway, I started to get really, really sick. It was December of that year. What started with a bad cough, night sweats, all of the things that you might associate with fever, flu, and so on. I did go to our local urgent care a couple of times. They, through examination, determined I might have pneumonia. They prescribed albuterol for, helping me breathe and make it through the cough. I will say that the second time I went, the doctor or the PA there said, if you don't get better, please don't come back here. You need to go to the ER. So that New Year's Eve heading into 2024, it was basically my husband saying, this is not sustainable. You need to get, in the car right now. And I'm similar in fashion to Neil when he said that I had never been to a hospital. I was very no, what are they going to do for me? And so on. So I went there, they tested me for everything, just like urgent care did. Everything else was coming up negative, flu, COVID, blah, blah, blah. Luckily, there was an ER doctor present there that day that upon talking to me, looking at symptoms, said pretty immediately that he thinks I have valley fever. At which point they did the test. Of course, I was in the ER. They said they're going to admit you, or they're going to admit me. The test is going to take a couple of days, which it did, and it came back positive, of course. All the while, I was continually complaining about how bad my head hurt, my neck pain. I couldn't really move it at all. I was getting like incredible spells of dizziness. So, it was being closely monitored, but it really took at that point an infectious disease specialist who I continue to work with to today to come in and say, you've been getting like these terrible headaches, neck pain. I'm like, yeah, it's not just I'm getting them, it's constant. So finally, he ordered up a lumbar puncture to test for meningitis, which did come back positive. So, even prior to that, I had already started fluconazole. It did start to help immediately. I was in the hospital for 8 days. Again, very pregnant. Baby was born, healthy as can be, that February. I did receive the news that due to the disease, of course, I cannot have another child, which was a little bit heartbreaking. Since then, the fluconazole seemingly was doing good. I was on a fairly conservative amount considering how bad it had gotten. I did end up developing even still hydrocephalus, which I was diagnosed with this last July 2025. Had all the symptoms, went to one ER where the doctor didn't really listen and sent me home. 2 days later, I went to another ER where it was diagnosed through a simple CT. After that VP shunt surgery, I was put on posaconazole instead of fluconazole, which has been fine. I will say with fluconazole, yes, I experienced hair loss, but I was also postpartum. So, I was kind of like, what's what? It's all confusing. The posaconazole is still somewhat of a conservative amount. Hopefully we get to lower that in the future. But it has been fine. And luckily I haven't received pushback from my insurance company because that's awful. I did have to have another revision to my shunt this last December after hydrocephalus symptoms had come back. And then more recently, in the last couple of months, I've been experiencing some pretty severe lower back pain. And really that has happened since the second shunt surgery. Finally, after much back and forth, I was able to get an MRI with contrast and without contrast. And as per the doctors and the radiologists, they do believe that it is meningitis related. So it has caused, again, pretty severe back pain and then pretty major sciatica down my left side. So that's kind of what I'm currently dealing with at this time.
That's hard. Thank you, Jessica. And remind me to chat with you afterwards about a couple things. We're going to do some follow-up stuff. But so next, I'm going to introduce Ashley. And Ashley is another patient that has a fairly long history with Cocci Meningitis. So thankfully, she's also a fairly fast talker. So although
Yes.
I think Elijah's going to hold the record for the day.
Okay, so I'm Ashley. I live in Tehachapi, so just 45 minutes out of Bakersfield. I also got diagnosed in 2016, but I was 32 weeks pregnant when I got diagnosed. So what happened with me in the beginning was that I went to the hospital because I had like a really bad sore throat. And they told me like, "Oh, like, we'll just give you some antibiotics to, like, help you with the sore throat," and then they sent me home. I went to the hospital here in Tehachapi, And then my antibiotics were out, and then like the fever started coming, the headache started coming, and of course being pregnant, you're limited to the medication you could take. So I was just like surviving off of Tylenol and the antibiotics they gave me at that time. So eventually I went the second time because my mom noticed that I wasn't getting better, and she took me in and they told me like, "Oh, like she's not getting better because she has a UTI, so we need to give her like more antibiotics." So then I went home again, started taking those medications, and eventually my mom started noticing that I was becoming like I was like a little off. And like I was kind of like talking like gibberish and like kind of like hallucinating in the sense. So then she's like, "Okay, like," and get this, I'm only going based off what she told me because I feel like I wasn't fully there at this time, but she drives me down to Bakersfield because she's like, "I'm done, like, with Tehachapi, like, we need to take her down to Bakersfield and figure out, like, what's actually going on." And she says that I was, like, talking to her, like, words it wasn't even full words, like, the whole way, and, like, I was, like, hallucinating, like, saying random things. This is all on the way to Bakersfield, so a 45-minute drive. And we get there, and she tells them, like, what's going on. They run all these tests. They put me in, like, an isolation room because they didn't know what I had and if what I had was, like, contagious or whatever. So finally, Dr. Haidari, my favorite doctor, he saved my life. He came in and finally decided to do some tests, and he told my mom that I have valley fever. And my mom was like, "Well, what's valley fever?" Like, at this point, like, she didn't know what it was, obviously. I didn't know what it was. So she was scared, and then he told her, like, what valley fever was, and then he started, like, telling her, like, "Hey, like, we're gonna have to, like, do this and this, but in order for us to do this, like, we're gonna have to, like, induce her and get this baby out and start to, like, treat her." So at this point, I was 32 weeks, so I got diagnosed actually 10 years ago, 5 days ago. So it was 10 years, 5 days ago, and, they induced me 3 days later after I got the news that I was diagnosed with the Cocci Meningitis, and I had my daughter, and then instantly, like, right after, they had to put in a shunt, and they actually put me on hospice. I was on hospice for 10 months because they didn't know if I was gonna make it, and they did start me off with fluconazole, and then they did amphotericin B. I did amphotericin B. I was actually a patient with Bob for the longest time until he moved, and then I graduated, but a little bit along the road, they I started, um fluconazole started to, like, not work on me anymore, like, it wasn't doing anything, so then Dr. Haidari had to move me up on a medication, so then I started voriconazole. I did that for, like, about 2 years, and then that ended up not working for me either, so then, like, that's what started getting my doctor, like, a little worried, like, he's like, "Oh my gosh, like, what else am I gonna give her? Like, she's already taking, like, all this, like, strong medication." So finally, he did put me on isovuconazole, also known as Cresemba, and that's what I'm currently on now, and that was a blessing in disguise. I've been okay now, but that all happened after I must go back a little bit. In 2022, I did have a surgery, unexpected surgery. I got really sick. I got really nauseous. I was throwing up and I was feeling really off. So my mom instantly knows that. She just drives me down to Bakersfield because that's where all my valley fever doctors are. And she drove me out and they're like, "Hey, like she has a brain infection. Like we need to remove the shunt and her Omaya reservoir because they're infected, and like we need to do that ASAP." So I went in, I was in the ICU for about 25 days with, like, a temporary drain when they removed that, and it was a blessing in disguise because it turns out that when they removed everything, they checked my actual CSF fluid, and it's like I didn't even have valley fever anymore, so I was getting all these amphotericin B treatments, and they were making me really sick. I could remember, like, the last couple times before that surgery, my mom kept telling me, what if you don't need treatments anymore? Like, you always trust a mother's intuition." And she told me, like, "What if you don't need treatment? Like, this is making you more sick than usual." Like, obviously, it makes you sick, like, you throw up, but, like, I would be out for days. Like, that's how sick it would make me. And then I had this surgery in 2022, and it's a blessing in disguise. Now I only see my doctors once every 6 months. I've been taking the isovuconazole. My daughter is perfectly healthy. She's 10 years old. She turned 10 3 days ago, and I'm doing great. Like, other than that, I just deal with like severe anxiety because of all the trauma that I went through with like me and then my daughter being in the NICU and then not being able to like raise her because of this disease and being on hospice. So now I deal with just anxiety with all of it. But other than that, I think I'm doing okay.
You're doing amazing. Yeah. So for this panel, I'm going to ask Susan to share her story. Again, we want to get into the discussion. So Susan, you have a very interesting story as well, but if maybe we can flesh it out a little bit more in the discussion, but I want you to make sure that you get a chance to speak as well.
Okay. So I'm Susan Franke, and I live outside of Phoenix. I guess my story is quite different than everyone else's because I was born with tetralogy of Fallot, which is 4 simultaneous heart defects. So I've always had a rare disease, a lifelong rare disease. So we moved to Phoenix from Chicago in a new area that was under construction. And I was never warned about valley fever when we bought the house. It was never disclosed. So when I first got sick, my symptoms were that I just couldn't walk. Like one day, I just couldn't walk. Very severe headaches. My neck hurt. The light sensitivity. And on top of that, I lost 64 pounds. So weight was just coming off. So one night, I thought that I was having a stroke. So they took me to the ER and they said, oh, this is because of your congenital heart condition and it'll resolve itself and you're fine and everything. So I said, well, I want this to go to my cardiologist for review. So when he looked at all of the information and the imaging, he said they were completely wrong and it was not due to my heart. So it took me about 1 year to get diagnosed. I went to 8 hospitals. I've been to multiple ERs, and it wasn't until I was no longer lucid that they took it seriously. And my husband dragged me there. I don't remember a thing. And they suspected valley fever based, I believe, on an MRI. And then I had to wait to go off my blood thinners to do the spinal tap. And at that point, they did say it was Cocci Meningitis. So I was in the hospital for a month, and Phoenix Children's had to send in a tetralogy of Fallot specialist to keep me from going into heart failure. So it was very nice of them to do that. But what is interesting is once I was under the care of Dr. Galgiani in Phoenix, he looked at all of my imaging and he noticed that the fungus was only on the left side of my brain and not the right. And that's why I did not need a brain shunt. So my first heart surgery, when I was 5 years old, they took this vein out of my left arm and they put it into my heart as a shunt. So that changed the circulation of my body. So the fungus could only get to half of my body, which they had never seen before. So that's different. And then what Dr. Galgiani did was he sent me on to NIH to talk to Dr. Stephen Holland. And so they were looking at both my heart and my brain together to try to figure all of this out. And in the meantime, I ran my story by 2 of my cardiologists, Dr. Wayne Franklin and Dr. Jordan Auerbach, who agree that the BTT shunt I had at age 5 did change my body's circulation and therefore prevented me from needing a brain shunt. And I guess the number one thing I want to say is I tried fluconazole, as everyone else did. And because there's not a lot of research on congenital heart, it was slowly giving me bradycardia to the point that I was starting to go into heart failure, which they were trying to prevent. But having 2 rare diseases, nobody knew what was what the whole time. So finally, when my heart rate was in the 30s, they took me off and they put me on posaconazole. So that was a game changer for me. And I want to reinstate what Bryn was saying, that we should not be denied this medication. My insurance has turned me down multiple times, and it's always been a struggle, which I feel like I shouldn't have to go through since it is available and it does work for me. And I guess the number one thing, I want that to be made widely available to everybody because it does work. And for conditions like mine, I can't take itraconazole because that can cause heart problems. So it's all very intertwined and very complicated. Let's see, one other main point, my last point is because I've had 3 open heart surgeries, I want to state that Cocci Meningitis was by far the most painful thing I've ever gone through in terms of physical pain. And I really want doctors to know that. I have experienced pain, and this is far worse because you can't get comfortable and it's just unrelenting. So thank you for listening.
Thank you very much. And I can also say that I'm on posaconazole, and my copay on a good day is $250 a month. So it is difficult. So we're going to start the panel discussion. So my co-moderator, Bryn, is back in, and then we're going to pop in Jessica, Susan, and Ashley. And Bryn's going to have some questions, and I get to do a little bit of follow-up.
Well, good morning again. Thank you so much for sharing those stories. I mean, they're very powerful stories and really highlight the severity of the disease that we all carry with us. The first question that we have for you today is, of all the symptoms that you experienced because of Cocci meningitis, which symptom did you feel like was the most disruptive to your daily life?
I would say recently the development of meningitis in my lower back, mostly because, I mean, I work, I have to sit all day. That really, really irritates it. Even trying to stand is quite difficult or stay in one place. I also have a 2-year-old. He's a big boy, he's 30 pounds. So, being hesitant to pick him up sometimes is truly heartbreaking. So I think that's been my hardest one. And maybe it's just the most apparent because it's so recent.
For me, I feel like I don't really have any symptoms from the valley fever itself, but I think the thing that drags on me every single day is that constant anxiety that anytime that my body does feel off or it feels a little different, I instantly go into panic mode and start thinking oh my gosh, I'm gonna have to go to the hospital again, I'm gonna have to get another surgery, I'm gonna go back to from where I first started again. It's just that panic that I have constantly that I'm dealing with. But other than that, it's just that basically.
And I would agree about the anxiety for sure, having this and a heart condition. For me, the long-term effects are the loss of balance, which some days my balance is fine, and then other days it isn't. And I never know when I wake up in the morning what kind of day I'm going to have as a result of that. And also, I think the fatigue is difficult. And it's something that I wish I could control. I try to sleep enough, eat the right things, but some days are just not good days as a result of this. And I feel, like I said prior, this is more from the Cocci meningitis than my heart condition, because I could maintain that my whole life.
Yeah. All right. Well, I can relate to you guys. So, I mean, I'm sorry that this is what we're all faced with. Even I feel back to where I was before I got sick, but like Susan said, I still sometimes have brain fog or, feel more tired than normal and wonder, is it because of the Cocci meningitis or am I just under stress or, what is leading to that? Next question is, are there any specific activities that are important to you that you cannot do at all or as fully as you would like to because of your condition? And Jessica, I know you kind of touched on this with your child, but is there anything else you'd like to add?
Yeah, I mean, I'm very, very active. I love exercise and kind of going back to it's the headaches in addition to the back pain. At this point, I cannot really jog or run or do things like jumping jacks and things like that. It causes a lot of pain, both in my neck, brain, and lower back. So trying to work through all of that through, various methods outside of medication, massage, physical therapy, all of the above. But at this point, I cannot do those things and I miss them.
For me, I make glass jewelry as a hobby, which requires a kiln that heats up to around 1600 degrees. So fire and brain infection are not necessarily your best combo. So my poor husband has learned to do the kiln part, and I prepare all the glass and the design and everything, but he puts it actually in the kiln for me.
Nice.
For me, I guess I clean houses with my mom. She has her own business. But like some of the things I do realize is because also when they like did put me on hospice 10 years ago, I did have to do like physical therapy because it did affect the valley fever did affect like all my joints and like my bones and stuff. So I do notice myself like aching really bad, or like sometimes like my leg just gives out and like I can't really hold myself up because I don't have, like, the strength to do so in my knee. So I do notice that those are, like, a few of the things that do kind of happen to me.
So I would like to ask a couple follow-up questions, but I also want to indicate something. So some of you have put some questions in the Q&A as well as the chat. So the two that are identified in the Q&A, we're actually going to be talking more about that in this as part of the second topic. So we will incorporate those discussions there. Just wanted to let you know. And then, so for all of you, I kind of know the answer, but I'm going to ask anyways. Did you take a break from work or school because of your condition, and how much have you been able to resume? How much time did you have to take away, and were you able to resume?
I'll go ahead and start. So for me, when I first got diagnosed with the valley fever, I was 18 and I had just brought a baby into this world. So I was just like, okay, like I need to do something for my life because I was a single mother at the time. So like I just remember like obviously it was like it probably was like 3 or 4 years after I got diagnosed until like Dr. Haidari gave me the magic words and he's like, okay, like I'll let you go to college, but like you have to like make sure like because it was I would still have like treatments throughout the day. So I had like to base my schedule around my treatments. So I did end up going to medical school. I would do from nights from 6 to 10, sometimes right after my treatments, just to like get a life for myself. So I was very fortunate that I was able to do that. And I am an ultrasound tech now. So thanks to him giving me like the thumbs up, I'm like, hey, like you're somewhat doing like you're doing okay enough to where you could go back to school. And now I have a career for myself and for my daughter. And it's amazing. But it did take me a lot of time to get to where I am now.
For me, I'd had my third open heart surgery about 5-6 years before I got meningitis. And in the meantime, we moved to Phoenix for retirement, mostly for my husband. And just at this point, it's not really an option. I don't think I could handle working other than volunteering. So I fortunately was a reference librarian and could take my pension from that. So I was very lucky in that regard.
I mean, Jessica, how much time have you missed, do you think?
I do. I work very full time in kind of a high stress tech job. Over the course of the last 2 years and having various surgeries and being out, I've probably had to take a month off or so total. And luckily, I do work remote. So, on days where I do feel kind of ill or down, I still have access and I don't have to go anywhere. So, that does help in a way. But as far as actual days out, probably close to a month.
And then to kind of follow up with that, and we'll ask everybody, I'll start with you. What changes have you made to your behavior and schedule because of your disease and your symptoms?
I am less active than I used to be. I mean, by that, like outside of work and family, as far as outside exercise goes, I still, try, but for the most part, I'm not nearly as capable of doing things that I used to. I am increasingly more and more tired. That could be partly life, but I do believe a lot of it has to do with the disease. other changes I've made, I mean, I do things that are necessary for my family and I. So, you know, while I feel like it would probably be beneficial to make deeper changes, I kind of feel like at this stage I'm in a place where I can't. So.
I would second that for myself as well. When we lived in Chicago, I felt like I was very social. I was in a lot of clubs. I was in many jewelry, I guess, workshops, art fairs, and then I had my librarian friends. I just had like friends from a variety of places. And here I just feel more isolated because of the mobility. It's not always easy. Or I could wake up and have a bad day the very day that I'm invited to something. So I do feel it's taken a toll in that way.
Yeah, I've definitely had to take like a step back from like my life before to now. And like as a mother, like I still tend to do like my daily I homeschool my daughter. So like I teach her at school and then like for my now fiance, like like dinner and stuff. But like other than that, like recently I've this is my third year I've taken off from ultrasound, so I haven't worked in 3 years because of that brain surgery that I had in 2022. Like it just triggered my anxiety really bad. So because of the anxiety, I feel like I can't do like a full-time like setting job where like I would have to drive, because I would have to drive to Bakersfield for work and I would find myself pulling off on the freeway and having severely like panic attacks that I wouldn't even be able to drive, and like an ambulance would have to come get me. So I get that too.
And that's actually kind of what the next thing we want to talk about was the impact on your mental health and what you experienced. I mean, I want to kind of ask everybody in this group that question. I know, Ashley, is there anything you want to add to what you're already starting to say? Or,
I think just more than everything, like I'm feeling okay, but I think the main thing is my mental health. Like I just recently got put on anxiety medication, but I'm like at the point where like I'm scared to like put anything different into my body or like the side effects I'm going to have. Like taking anxiety medication gives me anxiety, I'm like at that point, and like it's just one thing that I've learned kind of how to cope, but I do tend to like find myself every day like, oh my god, like to like it's rare when I have days like, oh my god, I didn't have anxiety today, like today was a good day, but it's definitely tough, and it's battles that I'm like fighting my demons every single day, but it's nothing that I know that I can't get past. I'm just learning to live with it every day.
For me, because I had a prior rare disease, I was used to constant stress my whole life. I mean, this definitely compounds it. I'm not going to lie. I feel more stressed out. And I guess just the main thing that I do to calm myself down is know that I try to go to the very best doctors, try to have really genuine friends around me, which I've been fortunate to have. And really, you have to take it just one day at a time. Because when I start to think about, oh, I have this rare heart and rare brain condition, I can freak out. So I just have to, today we're focusing just on this. But my husband will tell you I am very anxious.
Yeah. It's similar, and I love kind of the positive outlook there from both of you. This is a 2-year, like in the last 2-year development for me. And prior to this, I had nothing medical going on. So for me, it's been a learning curve and difficult to just be realistic that I do have a chronic condition that I'm going to probably have for life. And try not to let it get the best of me, but at the same time, it does provide, or it is a source of anxiety, and it does kind of get me down sometimes. So yeah, that's where I'm at.
I can relate to all of those feelings for sure. Having gone through it myself, and that support system is key to bring you up in those days that are heavy and hard and where it does get the best of you. So as it relates to your condition, we have good days, we have bad days, we've had probably the worst days of our lives from our condition. Let's talk a little bit about what a good day looks like for you all and what a bad day looks like for you all.
Okay, I'll start. So for me, last week my friend came in for almost a week from St. Louis, and fortunately, 4 out of the 5 days I had a pretty good day. So we could go to lunch, we could talk, and we watch a few movies, and it was just really nice to feel like my old self because I've known her for so long. But then on the flip side, when she left, I was kind of in bed pretty much all day for 2 days, just recovering and getting my energy back. And I guess for the worst days, I'm always seem to just be in bed the whole day if it's a bad day. And I can't predict when that will be.
So for like me, my daughter's birthday was on Saturday. So like we went to Johnson Grill Pizza. I was fine that whole day. But then just like how she said, the next day we were going to do a shopping day because my daughter has a birthday weekend, not a birthday, a weekend. So the next day we went shopping, and that whole day, like I was driving again, I had to pull to the side of the road. Thank God my mom was next to me. I was like, you know what? Like I'm feeling like really anxious, but I feel it's because I didn't give my body that time to like fully like rest. And like I was go, go, go the whole time. So the whole shopping day, like I had to call my fiance because something about him, like talking to him, like soothes me and helps my anxiety a little bit. So like he was in Lancaster at the time. So he's like, if I have to drive over there and come pick you up, like he's like, I will. So it's just like sometimes hearing that and like making sure that like I'm gonna be okay is just what I need. But like I ended up coming home from that, and I just napped. It was like around 6, and I didn't wake up until the next day. And even then, like I felt like groggy. So it does take a little bit of time to like recover from things like that.
Good days, I will say for the most part, I feel normal, yes, again, tired. The back pain's been a bummer. I will say I have like 3 or 4 good days, and I don't know if I overdo it or whatnot, but come that 5th, maybe 6th day, I can be in a lot of pain, back pain, joint pain, overly tired. Also, I mean, it can affect kind of my mentality and my, ability to be present at home. Sometimes I just kind of want to like huddle up and lay in the bed when I honestly can't really be doing that given work and kids. So yeah, good days, bad days. For the most part, I'm okay. Thank goodness for medication and the treatments. The days of bad hydrocephalus, that was a different story. But, again, the VP shunt has helped alleviate that.
Do you guys think you have more good days or bad?
I feel like I have more good days and bad days, but it's also depending on like what my mental state is. But other than that, like I feel like I'm doing okay on that standpoint.
And I feel, again, the mental health issue, I agree with you so much on that.
I know.
Lately, I've had more good days, which is very exciting because, I was in the hospital for a month. I had to go to rehab for a very long time, and it took me a year and a half to walk again without assistance. Those were all bad days. It was a very hard thing to go through. And as I said, it was more severe than my heart condition.
Yeah. Similarly, I would say that I do have more good days at this point than bad days. Prior to the hydrocephalus, that was kind of a development, and there were a lot of bad days, not many good days. So, kind of living with like that. Could that happen again? But for the most part, good days ahead.
And then what would you say worries you most about your condition?
For me, relapse is the most terrifying thing because I'm a very strong advocate with my other health conditions, and I'm very good at, protecting myself and fighting for myself. But when I was not lucid, I couldn't do that. And just the thought of being put in that position again, it just terrifies me. And I was very lucky when I was sick that my husband has a strong background in public health, and that was his whole career. So he could advocate, he understood my conditions. But I feel, what if I was in a strange place and no one could advocate for me, what would happen?
Mine would also be relapse, only because like I've had the privilege of watching my daughter grow, and like she gets scared. Like my poor daughter has PTSD every time I go to the doctors because she's never going to know, because when I had that brain surgery in 2022, like I just went to the hospital sick, and then I was in ICU for 25 days and I came back bald because they had to like shave my hair to like remove all the shunts. So like that was very like traumatizing for her. And so now every time I have like a doctor's appointment, like she just gives me like the look. She's like, "You promise you're gonna be home?" And I'm like, "Yes, babe, like I'm gonna be home, like no worries." But it has to do with that, because that was probably one of like the most rough like parts of my life that I've ever been through. And like I hope that I just never have to be there again ever.
Yes, similar to these two, of course, there's the worry of relapse, having two little ones. I just want to be there for them. They need their mom. And yeah, it would be awful to go through that again. I also know this is kind of a crazy thing, but I often wonder what would happen if there were a situation where we were unable to get medication for whatever reason. I often wonder, what that would lead to, and I don't think it would be good.
Those concerns are all very valid, and I think shared by all of us that have struggled with this disease, and by our family members that have watched us struggle with the disease and get better, but then always have that fear sort of lingering of what if it happens again. So you guys have talked a lot about how you're feeling much better than with treatment, but let's talk a little bit about your condition and how your symptoms have changed over time.
Well, for me, the fatigue, like I said, does come and go, so it's better. The mobility is probably my worst symptom, but I would also say the anxiety again, just because if I go somewhere, am I going to have a problem walking all of a sudden? That, which has not happened, but your mind goes places. And just I wish I could be more social, because I feel like I'm a very social person. So, yeah, it's changed me in that way.
Yeah, mobility due to the back pain. Again, going back to that theme of I'm not able to be nearly as active as I used to be. And then, the medication, of course, has completely squashed the neck pain. I do get headaches. They're not nearly as bad as they could be as they were. And then hydrocephalus, luckily at this point, I'm not feeling those symptoms. I've had, of course, the first surgery prior to that, and then the second surgery prior to that. So being constantly aware of those coming back, because they are quite obvious.
I feel like with me, it's just like I've just learned how to live with like all the symptoms. Like a headache, like okay, I'll just take Tylenol, or like something like brush under the rug type of thing, where I just kind of cope with it because I'm just like, okay, like this is my everyday living. So it's been 10 years and I'm far to where like I used to be 10 years ago, which I'm extremely grateful for. But it's just one of those things where I just kind of learn to live with these symptoms and just become like my day-to-day thing. So it's okay.
Would you say that your condition today is well managed?
I would, and it's thanks to Dr. Galgiano, because he took the time to learn about my heart defect. And other doctors don't want tetralogy of Fallot. What is that? But he's looked at my scans. He's talked with my cardiologists, and I really think a lot of it is just thanks to getting the right doctor, which I can't stress enough is so important.
I could agree with her as well. Like I said, like since 2022, I've been better than ever. My titers have been super low. They're like less than 1. So like that gives me like a good like I have to keep telling myself that for like my mental state, so it makes me feel good, but I feel like I'm doing great overall compared to how I was before.
Yes, I feel like it is well managed, and I do feel fortunate. In my area, I'll be honest, get good medical care for specialized conditions is hard to find, but I do have access to an infectious disease specialist and a brain and spine specialist here close by, so I don't have to travel outside the area, which is very common with anything major. I will say one point of frustration is the kind of practices and the doctors not necessarily talking to each other much. I constantly have to be, and my husband is a big like in between person, constantly feeling like we have to communicate between the two, where it feels like it should just kind of be like one big team. If I have records over here, obviously those should carry over here, but we're constantly having to deal with and coordinate these things, then that is a point of frustration.
How long did it take you guys to get diagnosed with Cocci Meningitis, from symptoms to an actual diagnosis?
It
I
took,
wanted, oh, go ahead.
it took me a full year. And I was tested for everything from cancer. I went to a leukemia center. They thought I had a stroke from my heart disease. You name it. I went to literally every hospital you can think of in Phoenix. And it wasn't until Banner that they figured it out. So it was not easy.
I want to say it took me about a month and a half. Like, obviously, I got like misdiagnosed twice. Well, I wouldn't say miss because I'm pretty sure I did have those things, but like it wasn't like valley fever until I went to Bakersfield, but that was like the third hospital visit.
Yeah. Similarly, I would say about a month from first feeling symptoms that I thought were a simple cold to actual diagnosis, about 1 month total.
And while you're in the process of getting diagnosed, what do you think was the key symptom? What was the biggest problem that you were experiencing in that time?
Mine were fevers. Mine were fevers, like, and of course, being pregnant again, like, you're just so limited to, like, taking any medication that, like, I was just living off of Tylenol, and then they would spike up to, like, 103, and that's what would really scare my mom because she's like, "Okay, like, it's not only you that you have to care about, it's, like, your baby too." Then that's when it started, like, "Okay, like, we need to do something about it," and that's what made her want to go all the way down to Bakersfield and that's where they diagnosed me.
So mine was loss of appetite in addition to the lack of mobility. And I was just very weak. And I was diagnosed during the pandemic times. So my cardiologist was trying so hard to get me to the right place the first time because of the exposure. You know, congenital heart defect is very high risk for during the pandemic. And then people were always trying to just blame it somehow on that. Even though I was saying, I can tell you it is not my heart. And just, I guess, the overall weakness of being so sick.
Yeah. My cough was awful. The night sweats were a sign. And then when I went into the hospital, I had very, very low blood pressure, alarmingly low. So I think that those were the things that the doctor said this very well could be valley fever.
Bren, what about you? What was your length of time to diagnose your biggest issue as far as symptoms?
So for me, it took about a month to be diagnosed from symptom onset. My symptoms started as headaches, and I wasn't really a headache person. And my headaches got progressively worse. And when I knew something was really wrong with me was when I lost my appetite, because I'm definitely a foodie. I love food. And I sat down for lunch one day and had no interest in eating the lunch that was served to me. And I was like, guys, there's something really wrong with me. And so I started seeking medical care because I just knew my body and knew something was wrong. And those symptoms progressed really quickly after that. It was about a week's time that then the nausea, the vomiting, the extreme fatigue where I couldn't even take a shower without just complete exhaustion set in.
Yeah, it took them 6 weeks to diagnose me, and I had meningitis the entire time. And I mean, to the point where at the end of it, I was living in a pitch black room with a light. The light on my cable box was even covered. Like, that was too much light for me. And I tell people all the time that only in the context of Cocci meningitis is 6 weeks to diagnosis considered a success story. And it's just so strange that that's an aspect of the disease. Wanted to ask a couple follow-up questions from the Q&A. One is for Ashley and Jessica. Since you were both diagnosed during pregnancy, how much do you feel you were involved in the risk-benefit discussions related to your children and the pregnancy? Do you feel like there was an ability to have any discussion about what was going on and what the risks were, or what do you recall about those conversations, if any, with your doctors?
Honestly, I can't remember because, again, like at that point, I was like hallucinating and like delirious almost. But like, I just know based off like what my mom what she has told me, and like she was obviously concerned for like my daughter, and like the risk were like, is she gonna make it? Like, what are the risks of her like having her at 32 weeks? Is Ashley gonna make it? Because I do remember her telling me that she did have to like sign this consent form saying like, hey, if it came down to saving like your daughter or your granddaughter, like who are you gonna choose? And my mom told him like, I'm not gonna choose any. Like, she's like, I trust my doctors, and she's like, and I have my full faith in God, and they're both gonna make it. And with the grace of God, we're both here. And see, she never signed any paperwork. So I mean, that's what I could just remember from that.
Yeah. I will say, I don't know if this is necessarily part of that question, but one thing that was very, very apparent is, and maybe the lack of knowledge around when you're in an endemic area, how badly it can affect women in their third trimester. Because we are immunocompromised, and I get asked all the time if I was, working outside, gardening, whatever it was. I'm like, no, at that point, I sure wasn't. I was maybe walking my dog or something like that. There's a lot of construction going around my house, so maybe that had something to do with it. So lack of knowledge, I would say, across the doctors who I was working with. In fact, I had one blood test come back that was really, really high in eosinophils, that they were just kind of, they were like, well, we don't know what that's about. And that probably was an early indicator of my illness that I had contracted, even though I was feeling no symptoms at that time. As far as, risk that was described to me, as mentioned, I was told that, moving forward, I'm going to be on this medication. It is very toxic to, those in their first and second trimester. Luckily, I was past that point. Same with you, Ashley. And the doctors I was working with, because I was saying I don't want to take anything until this baby is born. I had a doctor come in and kind of strong arm me and say, if you were my wife or my daughter, I would tell you to get on this medication right now. So that helped. I did it, and luckily everything was fine with baby.
Thankfully for me, yeah, that's induction was a huge factor, so I didn't have to like take anything until my baby was out, and then obviously I didn't get to like breastfeed or do any of that because of the medication. But other than that, like that's what they did with me.
Yeah.
What about plans for future children? Did your diagnosis change that? I kind of think I know the answer for at least some of you. But
Yes, I am. As of right now, I've been on birth control for 10 years because they did want to do a full hysterectomy at 19, but I told them absolutely not because again, like my faith in God is at 1,000, and I have faith that I am gonna get better to where, because I'm still young. I'm 28 years old, and I was like, hopefully by the time I'm 35, like it gives me some time to like hopefully get better, and them telling me like, "You know what? Like, you are doing better, like, you can have another baby," because I would like to have another baby in the future, but it's all just depending on what my health looks like.
Yeah, being that this was our second child that I was pregnant with, I'm a little bit older than Ashley is. We were pretty much leaning toward like 2 and through. We're gonna have 2 and be done. But just to be told that I cannot have a third or consider a third, I still think that that's pretty heartbreaking to
Mhm.
have that knowledge.
So we have about 5 minutes till break. So I want to ask one other question that's actually from the chat, and I think it's relevant to this group, but also to the next group. So I may ask it again. Is when you got on your drugs, how long did it take you to notice that you felt better, to notice a real improvement?
So for me on fluconazole, I feel like I never improved. It just because my heart was just the rate was so disturbing to me, and I had the hair loss, and I was still losing weight, and it really again it wasn't until posaconazole that everything shifted and I started to feel better. And then finally, after 2.5 years, I went dormant. But that to me is the magic drug. And my number one thing is please make that available to everybody.
I have a similar situation like you. Like again, fluconazole didn't work for me. Voriconazole didn't work for me. So it wasn't until about 4 years ago that they finally put me at like a dormant state, so where I feel okay and like safe, I guess you could say. So it was all because of the isobuconazole. So I agree with you on that.
Yeah, I mean, I feel fortunate in that my symptoms on fluconazole, once put on it, did start to diminish within 24 hours, if not 48 hours, and got increasingly better over the course of a couple of days. I think in total, the first time at the hospital, I was there for 8 days. So come like day number 4 or 5, I was feeling much, much better.
Bryn, how
Yeah,
about
for
you?
me, I was put on fluconazole in the very beginning, 1,200 milligrams, and I felt instant relief of my meningitis symptoms, which was great. But I was only on it from May until September when I started to fail, and my meningitis symptoms came back really quickly. And those headaches, those meningitis headaches, a meningitis headache, it is much different than a regular headache. And so called my infectious disease doctor, who put me right back into the hospital and was able to switch me to posaconazole, and felt immediate relief and have had no issues since then on posaconazole.
And I want to put one note in. My heart rate and everything actually improved from a cardiology standpoint on posaconazole, and that is documented.
Yeah, that's one of the things with posaconazole, which I'm also on. So to kind of end this session, I'll give you a little bit. So I was started on 1,200 milligrams of fluconazole in mid-February. And to answer the question, when did I notice an improvement? The first thing I noticed, one of the things I noticed, it was that my headache was no longer the all driving force in my life, and that I could actually do things. And that was around the end of May. So, it took 3 months for me to realize that my headache was no longer the whole thing. This is after diagnosis and drug. And that's on fluconazole. And I went on to fail fluconazole that October. And until they got the Ommaya reservoir in my head and got me on a combination of oral medication plus amphotericin, I really didn't improve. That was almost 2.5 years after diagnosis. So, that for those that improved quickly, I'm very happy to hear that. Unfortunately, it's not the case for all of us.
Mhm.
And, I think most of us, interestingly enough, I guess all of us failed the first drug that we were given for different reasons, which is not as well documented as it could be. So we're going to go to break in just a second, and we will come back at either 12:10, 1:10, 11:10, or 10:10, depending on your time zone. Bryn, do you have any final thoughts as we head into break that you wanted to add for this session? Because we're going to start with the new session after lunch, or after break, excuse me.
Yeah, I'm just grateful for you guys so willing to share all of this information. I know you're in a vulnerable state and you're sharing such personal information that's very emotional, and I'm just grateful for your willingness to do so.
And I would also add that for Ashley and Jessica, who unfortunately won't be able to stay for the second part, but were gracious enough to delay their work day. And Ashley, thank your mom for me as well.
Of course.
Thank you for your participation. And Susan and some others will be back after the break to talk about their experiences. So we'll start break now, and we'll see you in about 20-21 minutes. Thank you so much. Well, I hope everybody's made it back. So next on our agenda will be an update on treatment landscape from Dr. G.R. Thompson from the University of California at Davis, who is another amazing physician. And thank you for joining us today. I know it's a very busy day for you.
Yeah, my pleasure. Can you hear me okay, Rob?
Yes.
Okay. And how about my slides?
Yes.
Things are good. Okay, great. Well, thanks, Rob, for the introduction and the invitation to talk today. So I was tasked with really talking through some of the challenges with treatment. And part of this, though, and one of the most common questions we're asked by patients is, why do some people have such benign disease? They don't even know they were infected. And some people have such severe manifestations. And just to talk about this very quickly, because it is a big part of how we treat patients, is to walk through this. This is some work that was done on what does coccidioidomycosis or coccidioides look like under a microscope, and how does our immune system react to that? And so what you're seeing, that's a human neutrophil, and it's sensing an endospore from coccidioides. And you can see it senses it even without contact. It reaches out to try to engulf that. But that's the endospore form. But we know coccidioides also make spherules, and these are much larger, and a neutrophil can't sense those. It really doesn't leak any products that your neutrophils can sense. And even with direct contact, it has a difficult time. And then with phagocytosis to engulf that, you can see that just the structural physical characteristics, that's impossible. It's just too big. And this is one of the reasons that coccidioides is such a tough customer for our patients. Your immune system has a really difficult time handling this just based on the size of the organism alone. We also know that men have a severe infection more frequently than women. There's different patient groups that Geetha alluded to earlier with immunosuppressive conditions that really cause more infection. And then coccidioides has this very strange phenomenon of having sort of ethnic risks, and it's much greater risk in our Filipino patients. Those of African genomic ancestry have about a 10-fold greater risk of severe disease or meningitis, and other groups are under investigation. And we've looked at this from a lot of different methodologies, and really found the answer only for about 50% of the patients. But the patients have polymorphisms or differences in their genetics, just we all are a little different genetically. And those end up with differences in dectin-1, that sort of pink structure, and that's one of the ways you sense coccidioides. And in the signaling downstream, we found a number of differences in the genetics of some of these different factors, and that's why some patients get disseminated disease or meningitis, and other patients do so well. So this is really an area of active investigation, and we're hoping in the future, as genomics really continues to come online and costs decline for that, we can sequence all of the patients with bad disease and really tailor their treatment to their specific genetics to help them mount a response to potentially even cure some of these patients instead of leave them on drug long term. And then the last part, and I just added this during the discussion before, because fatigue is such a big component of our patients with coccidioidomycosis. It's a very complicated slide, And none of the data here really is, we're not going to walk through it in detail, but what we did is we took patients with valley fever meningitis and patients with valley fever who did not have meningitis and looked at what are called the metabolomics, like how you process a number of different factors in the body, and found tremendous differences in that. And the bottom line is that Cocci disseminated patients and meningitis patients end up with a metabolomic profile that looks just like mono. And that really explains the fatigue. It's mitochondrial toxicity from coccidioides and probably the patient's immune system as well. So the drug and antifungal therapy is to really try to tamp down the amount of fungus present so that your immune system can kind of convert and fatigue will abate over time. And we've got some interesting things hopefully in the future that can help speed this up and really help with the fatigue as well. And so this is just something I wanted to mention. We've really been working hard on trying to understand why our patients get so tired from the infection, and can we fix this? Can we really help patients with fatigue to move forward? So with that, just to talk more about treatment options and side effects, and this was talked about a lot. This is really the treatment pathway for most patients. They start on fluconazole, and then depending on what center they're going to be treated at, they end up on some version of the other azoles if they fail fluconazole or have side effects. And those are voriconazole, isavuconazole, itraconazole, posaconazole. They all have sort of unique side effects, drug interactions, and toxicity profiles that necessitate moving those around. And usually if you're on fluconazole, you get 2 other azoles before really moving down towards the bottom of this slide. And that's what we consider the salvage regimens. And intrathecal therapy was discussed. This is one of the ways we give amphotericin B directly into the spinal space. That's an Ommaya reservoir that's being injected there at the top. But that is very morbid for our patients. It's very time consuming. It takes a lot of resources, certainly from the hospital and the patient both. So we've really been hoping that some of the newer agents can push that treatment, intrathecal therapy, even further down the percentages that need that. And so dupilumab and interferon gamma, I'll talk about in the very last slide, but that's definitely something that we are hopeful that can leverage the patient's immune system and kind of push them back into fighting it off themselves. And then 2 newer drugs called olorifim and fosmanogepix, we often have to obtain through compassionate use protocols for our patients who failed other therapy. This slide really talks about the resistance profile for coccidioides. That's not something that had traditionally been discussed, but just like you can get resistance in bacteria, you can get resistance in fungi. And fluconazole has long been the treatment of choice for coccidioides. But when you take these different organisms, all coccidioides, and do susceptibility testing in a test tube, you see this blue in the middle here for fluconazole. Actually, fluconazole is probably one of the least effective drugs across the board for most coccidioides isolates in a test tube. It doesn't always mean that's true in vivo in an animal or in humans, but at least in a test tube, it's probably the least effective. And that's why we see so many fluconazole failures, we think, and patients tend to do better on itraconazole, posaconazole, voriconazole, et cetera. So that's an area of ongoing investigation and hopefully soon a clinical trial as well. And then the toxicity, this was really discussed, the fluconazole toxicity, that fluconazole has been long thought to be very benign. And that's because most patients across the globe that use fluconazole, they take 150 milligrams one time for a vulvovaginal yeast infection. Our patients take 800 milligrams or more every day and often for life. And with meningitis, almost always for life. And these patients lose their hair. They develop really dry skin or cheilitis. That's those really dry lips that can even bleed. And when we looked at our patient cohort here at UC Davis, we found 50% of the patients on fluconazole had self-discontinued it due to toxicity, which really speaks to the need for new drugs and other options, given this sort of cumulative toxicity over the duration of therapy most of these patients require. We actually looked at this even in a rat model of fluconazole to see why the hair loss occurred and figured out the mechanism as much as we can, and did find it is reversible by the mechanism we discovered, which is telogen effluvium, and tends not to occur with some of the other drugs, but voriconazole, et cetera, it certainly does as well. And then voriconazole, we have a really hard time using that here in California, certainly Arizona too. It's just we get too much sunshine, and voriconazole is a photosensitizer. So it accumulates in the skin, and then just sunburn can easily occur. Also, skin cancer occurs on long-term voriconazole, and then causes a lot of other side effects. It can cause some liver problems. It can cause flashing lights, the so-called photopsia. It's reversible. It's not a long-term side effect if they stop the drug. And then we do see fluoride toxicity. So you can see here's the structure of voriconazole, and there's 3 fluorides added to that. And this P position fluorine can come off and accumulate in the bone. And that's what this looks like on a bone scan of this patient here. This does resolve after if you stop voriconazole, that goes back to normal. But these are very painful for patients on long-term voriconazole, and just another side effect. And then the heart conditions were mentioned today, and you can see, I'll just bring your attention in the bottom right part of this slide, the QTC. And this is a measurement that we look at on EKGs that tells us sort of the risk of causing cardiac problems with azoles. So if the number that we look at of QTC is more than 500, we tend to avoid most of the azoles. Fluconazole and voriconazole and posaconazole all contribute to lengthening that QTC interval. Isavuconazole does not. It actually shortens it. So in some ways, it can get us out of trouble in the treatment of patients if they're on a lot of other medications that cause prolongation, and we don't want to do that. That's not something patients feel. It's something that we look into and take care of and worry about, but something we don't want to make worse by adding an antifungal to that. And then this is really some interesting work that we have done, but it explains a common side effect to amphotericin B. And if you look under an electron microscope to like what's the structure of liposomal amphotericin B, you can see what that looks like here on the left. And then just for comparison, we have put an enveloped virus on the right, and you can see they're about the same size, they're about the same shape. And we thought, well, your immune system might recognize these in similar fashion. And for these kind of things, you need an immediate immune response. You don't have time to make antibodies, IgM, IgG, like you do for a vaccine, et cetera. These are things that you want to protect yourself from, like a mosquito bite. You want to immediately recognize it, slap the mosquito so you don't get an infection. So these are sort of primitive parts of our immune system. These are things like histamine, IgE, or complement. And we found that this complement cascade is activated by amphotericin B infusions. And this is a complicated data slide, but the gist of this is your C3, which is part of your complement system, and then C5 through 9. They all are upregulated immediately after amphotericin B infusion, and what's lead to these infusion reactions that so many of our patients develop. The interesting part of this, though, is we found if you pre-treat patients with Benadryl or with Tylenol or with steroids, it tends to abate this, that they don't have as much complement reaction. And if patients can get through the first week of this, these basically extinguish. So it's really trying to get patients through with Tylenol, Benadryl, et cetera, so they don't have these effects long term. And then the last of these, itraconazole, posaconazole, we did this work a number of years ago, but we found a lot of our patients on these 2 drugs developed hypertension, high blood pressure. And so we really worked out the mechanism here. So now we really screen these patients diligently, even if they're on itraconazole, posaconazole, their coccidioides is going well, and they really don't have any symptoms. We make sure their blood pressure is normal. Because if they've developed high blood pressure from these 2 drugs, the treatment actually is different than most other mechanisms of high blood pressure. So we use different medications to treat the side effect, or in some cases, we even change them to a different antifungal. So that's sort of all the side effects with the drugs that we have on the market, and there are some drugs that are in progress for hopefully be on the market the next couple of years that might really offer big breakthroughs for this disease. And one of these is alorifim, again, not on the market, but alorifim is a novel mechanism. It works for coccidioides, but also a number of other really difficult fungal pathogens. And they've presented their phase 2 data, so they still need phase 3 data. But the phase 2 data was for patients refractory, resistant, or intolerant of other antifungals. You can see in the bottom right there what that looks like for one of the patients who had really severe coccidioidomycosis. And this patient, had even brain lesions, not just meningitis, but little abscesses in their brain from coccidioides. Also had skin lesions all over their body. Alorifim was added to their voriconazole. Eventually, voriconazole was stopped due to side effects. And then by day 256, all the brain lesions had completely resolved. The skin lesions had completely resolved. And after this patient was treated, they actually self-discontinued their medication because they said they thought they were cured, and we really do not advocate for that at all. We don't think that we have enough data, certainly, to make that assertion. But this patient we have just followed, she allows us to follow her, and she has since had a baby and been off meds for almost 4 years and had no signs of recurrence. That's only one patient, so again, we really don't recommend that, but alorafim might be curative for some of these patients, but we need to do a big study to prove that. And then the other new drug that hopefully will be out in a few years is fosmanogepix. It's also a novel mechanism. It works for coccidioides, but also a bunch of other fungal infections. It's not quite as far along in development yet. They're doing their phase 3 trials now, but available both intravenously and with an oral formulation. And we've treated about 12 patients with this drug now and had some pretty striking successes. But we do see failures still. So no drug is probably going to cure everybody. And that's why we need so many new compounds to come to the market, hopefully, to get patients better. And then the last of these is terletracin. And this is a brand new drug. It's only in phase 2 trials. But you can see in the top right there, what they have done is taken amphotericin B and tried to change the part that binds to cholesterol or ergosterol, which is what's in the fungal cell membrane. And if it binds to ergosterol, that's what we want. It'll kill the fungus. If it binds to cholesterol, which is what we have, that's when you get side effects. So they have rationally designed this drug to potentially reduce the amount of kidney problems from this class of compounds. And so the early data looks really good. It looks like there's not much kidney toxicity at all, but still maintains efficacy in the treatment of aspergillus. And so we're hopeful with coccidioides in the future, this might be a treatment option for some of our patients. It is IV, but it's only once a week. And so that would be a really potentially a big breakthrough as well for this compound. And then the last of this, again, I mentioned, is sequencing patients, really trying to understand an individual patient's immune response and how can we help tilt the scales, either tip it this way to get more response or reduce something that's too much as well. And the group at UCLA we've been involved with several other investigators has done this for a couple of their patients. They've really looked specifically at their immune system and which arm, Th1, Th2, that is too much or too little. And then they've sort of tipped this. They've tamped one down and then boosted the other side with some different drugs. And they've, in their early studies of 18 patients that they've used this interferon gamma dupilumab strategy, they've had survival in 16. So hoping a bigger study can be done as we really usher in the era of precision medicine the way we've done for cancer to give really individualized, tailored treatment. So that's it. Just want to thank Rob certainly for the invitation. Thanks to all of the people that have done all this work that we presented here, but we still have a long way to go to really try to get new drugs that cause less toxicity and improve efficacy. And then I'll stop here. But thanks so much, Rob.
Well, thank you very much, Dr. Thompson. This is very informative, and I think it's interesting that you are able to provide hard science mixed with patient-relatable information. And I think, judging by some of the internal comments that we've had with this panel, that there's a lot of thirst for that knowledge. And so I thank you for sharing it. And then now we're going to go ahead and start with our second panel. So we'll put that slide up. And this is going to be talking more about treatment burden approaches. Current treatment approaches and burden is actually what it's called. And so our first patient that I would like to introduce, and we're going to have a couple from the first session, but a lot of new patients as well, and caregivers as well in this session, I think is important, is DeMarque. So if we can go ahead and put him on the screen. Let's see if your camera's on. There you are.
Yeah. Yes, all right. Are you guys able to hear me?
Yeah. So if you just want to take 3 to 5 minutes, introduce yourself, and talk a little bit about your history with Cocci Meningitis.
Yes, sir. Yes, sir. Of course. Okay. So my name is DeMarque Hawkins, and I'm a combat veteran. I served 7 years in the Army as a combat medic. I was on terminal leave in 2017. I had already gotten into school. I moved back to Texas, to Lubbock, Texas. I went to Texas Tech, and I was in school. I went back up to Fort Lewis where I served to pick up my wife and bring her back on down to Texas with me. And this was in the spring, so January, February, March. It was March of 2017, and we were driving down, and we took a stop at the Grand Canyon. And on that day, it was pretty windy. It was I can barely remember it. My memory's spotty, but and I don't remember pretty much all of 2017. But I do remember it being very windy. And when we got back to Lubbock, it took about 2 to 3 weeks, and the symptoms started to come in. Um, I I got really severe headaches. I had never got headaches before at all ever, and that was weird. And then I lost my appetite, so I wasn't eating, and my wife started to get really worried, and she put me, or we started going to we went to the VA over in Lubbock. They couldn't figure out what was going on, and then we went to other hospitals in Lubbock, and they were diagnosing me with all these different things no one could ever, because it presents as something else. So they started asking questions. You know, was I taking any drugs, or was I doing anything that I wasn't supposed to be? And they just couldn't figure it out. And that so from March, March to January, March, April, May, around that time, we still couldn't figure it out. So my wife, it was getting worse and worse, and she just said, "You know what? I'm gonna take you to San Antonio, to the big VA." And she drove us from Lubbock to San Antonio, about a 5.5 hour trip. She drove us to, and I was out of it. I was completely out of it. Hydrocephalus started setting in. My eyes were crossed. The intracranial pressure was growing. So I was completely out of it. I didn't know what was going on. I have no memory of it, and my wife was getting really worried. And so we take that trip, and at the VA, there was a doctor named Gregory Anstead who had previous dealings with working under another doctor who had dealings with valley fever. And he kind of identified what it was. And that was January, February, March, April. But I don't think I didn't get diagnosed with valley fever until October. So it took about 6 to 7 months to really figure out what it was. And then from there, so I spent about a year and 3 months in the hospital, in the VA hospital. From there, I was on voriconazole and fluconazole. Had very bad reactions to it: dry skin, dry lips. I mean, it failed on me, which made me stay in the hospital even more. I lost the ability to walk, and then they switched me to posaconazole, and it was like almost immediately that things just started to turn around for me. And so from 2017 to 2019, I had to drop out of school, and then kind of go on this journey of rehabilitation. And from the time that I got on posaconazole, and I believe it was sometime in the first quarter of 2018, or probably in the middle there. Um, from that point on, it took till 2019 till I started clearing up the fog. I started getting my memory back. And then I went back to school at the end of 2019, and then COVID hit. And then I continued going to school. Obviously, got my degree in exercise science and kinesiology. and then got my master's degree in healthcare administration in 2023. And now I'm here in San Antonio with me and my wife, and we're recovery is probably a lifetime thing, but I've been so big on exercise, and that's been my main focus. I'm really health conscious. Really, before Cocci, before Valley Fever, I was never really sick, and then now I've kind of gotten back to that. So, yeah, that's my story.
Yeah. Thank you for sharing that. And honestly, as we have the discussion, there'll be some other things that about your story that I'm hoping we'll get a chance to touch on. But thank you very much, Marco. So next, I'm going to ask Chris to share a little bit about his experience, which again is a little bit different than everybody else's, but you'll hear some commonality. Are you there, Chris? Are you there, Chris? So when everybody's off, sometimes they slip away. So let's bring Janelle up, and I'll see if we can. Chris shows back up here in a second. So would you, Janelle, would you mind sharing a little bit about yourself?
Sure, happy to. Thank you guys for all this wonderful information and for sharing your stories. It's very touching and informative. My name's Janelle Rosenfeld. I'm the wife of a Cocci Meningitis patient, my husband, Arthur Rosenfeld. Some of you also know him as Monk Unro. I'm his part-time caregiver, 100% full-time emotional support and patient advocate. We've been through this together, and as all of you know who are on this journey, it involves everything in your life, including your family and loved ones and coworkers, etc. I was a full-time CEO. I ran a big business. I traveled the world, and when my husband got sick, I retired to care for him. Our story started when we moved to Tucson, Arizona from Florida. We moved here in 2019. We loved the desert. We spent all kinds of time outside hiking and enjoying the outdoors. We worked outside all of the time. And after we were here for about a year, my husband went back to Florida to visit friends and had a medical workup. He went to all of his doctors. And while he was there, they did a scan, and they showed some spots on his lungs. And they actually told him then in Florida that he had lung cancer. They tried to biopsy him. They poked him, 19 times. Couldn't find any cancer. They told him to go back to Arizona and find an oncologist. He found an oncologist who actually said, "Oh, no, you don't have cancer. You have valley fever." He was treated with fluconazole for about 3 months. Didn't tolerate it well, but they felt it was still in the lungs. So that was the treatment. He came off. Was feeling okay. This was right around in 2021. He was an early adopter of the COVID vaccine, got the COVID vaccine, started having terrible headaches. And the doctors told him, "Oh, well, these headaches are probably a side effect of the COVID vaccine." They didn't resolve. So finally we went to Banner ER. They did worked him up, did an LP, and the LP showed that he had very, very high levels of Coccidioidomycosis meningitis. And luckily, the oncologist who was still treating my husband was friends, knew Galgiani, Dr. John Galgiani. And so Dr. John Galgiani started treating my husband for the Cocci meningitis. He was back on fluconazole. He really failed with that, had horrible side effects, and it wasn't great for his kidneys. We tried posaconazole. Same with a lot of people, had problems getting it approved by insurance, but eventually was approved. Still he failed on that. But we were fortunate enough to be able to get on the Olorafim investigational study and began working with the fabulous, wonderful, talented Dr. Fariba Donovan, who has become a wonderful physician and friend and confidant for us, and really helped us through this whole process. The olorifim, although it does have side effects, fatigue, like everybody seems to be having, along with gastrointestinal issues, it was better tolerated by my husband. During the time he was on, or he's still on olorifim, but during this process, he continued to see improvements in his titers for valley fever, for Cocci. And it seemed that he was getting much better. I mean, we were all very, very pleased that the titers were really, really going down. However, about in late 2024, he started presenting with cognitive issues, a lot of gait and balance issues, memory issues, and in fact was sent by some doctors to the Banner Memory Care Institute, where one doctor even said he had early onset of Alzheimer's. Didn't seem right to us. At one point he fell. I took him to the EMD at Banner. They did scans. They did another LP. The LP showed very low levels of the Cocci, but he had hydrocephaly. And the neurosurgeon there told us that he needed to have a VP shunt, which he had. The surgery went very well with the VP shunt. Unfortunately, in recovery, the recovery room, he suffered a cardiac arrest, a STEMI, very, very severe. Had to go back into surgery, which, as you know, not ideal after having brain surgery, to have stents put in. We were told, my son and I were told, that he probably wouldn't survive. After surgery of 4 or 5 hours, he came out. They said, we don't know if he'll make it through the night. Of course, a brain bleed was looked at. Luckily, it was minor, and he was in the hospital for about 3 weeks. He recovered from the heart issues. So we were dealing with the cardiac arrest issues. He had a heart pacer put in, as well as the VP shunt, dealing with all of those issues in recovery. He couldn't go to rehab when he was ready to leave the hospital because he was on the investigational study, and they won't take, rehab places won't take drugs that aren't on formulary. So he came home. We had a good 2 months of bed rehab where yours truly, we took care of him. And good news was the VP shunt is working well. No issues with that. The cognitive issues resolved really quite quickly. The memory issues resolved quite quickly. Gait and balance took about a year. He's starting to get those back now, which is great. Of course, you know, everything about his life changed. He was an active 40-year martial artist and international master of Tai Chi, which he had to stop doing that because he could barely walk, let alone do martial arts. That's getting better now. So we're back at doing that. You know, big questions we had during the time is, even though the Cocci levels continued to decline, why did the arachnoid fibrosis cause the need for the VP shunt? Will that continue to develop even if the Cocci levels are going down? Is olorifim better for the arachnoid fibrosis, or is an azole better? So there's lots of questions that still remain, but luckily, as I said, we work with Fariba and John, and they're always available when we need them, and we feel very fortunate about that. So that's our story, my story.
Yeah, thank you for sharing that. Both of those physicians are amazing. I will also add that Dr. Donovan edited the Cocci information on our website to ensure it was accurate. We have a physician do everything. So next we're gonna get Wendy Purdy loaded up. So Miss Purdy, is it?
Yeah, can you pronounce that?
No, I can pronounce Coccidioidomycosis though. Yeah, so Wendy's also a caregiver. She's my caregiver, and she's the reason that I'm still alive today. But you had a much different perspective than mine. So if you would share just a little bit of it, I know we're going to get into it a little bit more through the discussion. So,
Sure. Okay. So again, my name is Wendy Purdy. Rob, my husband, was diagnosed in 2012. He started off having headaches. We joked about him having a hangover because it was New Year's Day, but he hadn't drank any alcohol or anything. And so we knew it wasn't that, obviously. Several times he was misdiagnosed, sinus infection, cluster headaches. There were several things that he was misdiagnosed, and it took quite some time before he was actually diagnosed, several months. In, I believe it was February, his headache was so bad, he was seeing spots, and I said, that's it, you're going to the emergency room. We were lucky that we went to Kern Medical in Bakersfield, California. A resident actually diagnosed him with CNS Cocci Meningitis. He came in, he kind of knew what he had. He did, the lumbar puncture, checked his pressure, and it was high. Got him on medication immediately. About a week later, they sent him home. 18 hours later, we were back in the emergency department with, he had a blood clotting disorder. It was lupus anticoagulant. It was where, it was attacking his healthy cells, basically. The same resident came by and saw him again and was like, hey, what are you doing back here? And why are you breathing like that? So then he had, he had a blood clot in his lung, and a couple of them actually. And he was in the hospital for 6 more weeks after that. During that time, he said that I'm going to do something about valley fever. And I believe him, because here he is again today. He also struggled with medications and being resistant to all the medications. The voriconazole was horrible. Now he's on posaconazole and he has Ommaya, and he's, as far as I'm concerned, I think he's doing great. There's still struggles, just like with everybody that has CNS Cocci, but I'm very proud of him. And that's all.
Thank you, Wendy. So we're going to try and bring Chris back on. I think there's Chris.
Hey, good morning, good afternoon. Now we got this rolling. As you can see, I'm a brother of Rob's. I have the matching Ommaya up here. I'm 55 years old. What's that?
And the secret handshake.
Secret handshake, yes. 55 years old from Scottsdale, Arizona. I do have a valley fever infection that was disseminated into the central nervous system, causing our famous Cocci Meningitis-related hydrocephalus. I was diagnosed with valley fever in my lungs in the spring of 2017. I had rapid weight loss, bad cough, night sweats. I was given fluconazole and was told, just get better with a little to no follow-up. That didn't happen. In the summer of 2018 is when I was finally diagnosed with disseminated Cocci on my spine. At that time, I had adhesions on my spine and had a terrible headaches, vision problems, shooting pain down my arms. That's when I had my C6 removed in 2018. In the summer of 2019, I was finally diagnosed with meningitis, which was causing hydrocephalus. That was the summer I got my VP shunt, so now I joined the VP shunt gang and finally started to receive around-the-clock phenomenal care from Mayo Clinic here in Phoenix. I think I've received every antifungal that has been used in Cocci. Several did not treat it well, and several caused side effects. With some not being effective enough, the valley fever had the opportunity to spread. I'm now being treated with intrathecal amphotericin B every 4 weeks into my Ommaya reservoir. I take Cresemba daily. Treatment's time consuming and is always a battle trying to get coverage through the insurance. So much of my life has been planning finances to make sure I can afford my medications. This doesn't account for the dozens of times I've been hospitalized with something going wrong with the health. It takes so much out of me to prove to the healthcare system and insurance system that none of this is elective. I didn't choose any of this, but now is life sustaining for me. There's not an aspect of my life that has not been affected by Cocci. My physical health is generally far worse than where it should be for a 55-year-old. As I feel at least another 15 years my senior. Even my treatment still has profound fatigue, bowel, bladder issues, tremors, brain fog, and those great memory issues. Without treatment, I wouldn't be on this call with you all. Mentally, I have forgotten some of the most significant events over the last years. Maybe that's not a bad thing. Like my own wedding, my many memories with my daughter's life. But the memories of the Cocci are, I have a daughter to jot notes down and a wife to take notes of everything that's transpired. Emotionally, I have a great deal of shame with this disease. It is taken from me because so much of my life is compromised. It's significantly reminded me of my mortality, the silver lining, becoming a better, more present father and a husband person in many ways, facing these obstacles. When this disease essentially retired me, I was far from ready to retire. I have a strong desire to work, but it stripped me. Early from infectious disease has been really important to preventing the disease from worsening. More research into the antifungals. Yeah, I've been through it all.
And I can say that when I often say about the difficulty with us as valley fever patients is the only thing that we don't need one of when it comes to diagnostics or treatments or prevention. The only thing we don't need one of is the stuff we need two of. You know, we need everything to improve our conditions. And Chris, thank you so much. I know it's been hard for you for sharing your story. I'd like to bring Susan and Elijah from the first panel back, along with Janelle and Wendy and DeMarque, and obviously my co-moderator, Bryn. It's a nice full screen. I like that. And Elijah's having a little bit of potentially bandwidth issues, but hopefully he'll materialize and we can. It's all right. You know, Elijah, I truly appreciate you being a part of this, as well as all of you. But so let me start with just some general questions, like we've been doing. What are you doing to treat your condition / symptoms besides taking the medication? What else are you doing for your health? DeMarque, will you start, because I kind of know your answer.
Yes, sir. So while I was in the hospital, one of the biggest things that I promised my wife was that I was going to get back to my training. That's something that I've always done my entire life. While I was in the Army, and then before the Army, I was a college basketball player. So I already had kind of a base of of training to get back to. I already knew where I wanted to go. So that was the main thing. As far as treatment goes, posaconazole allowed me to get back to normal. And when we got out of the hospital, I went back to my training. But to start off, I didn't jump right back into it. I didn't go crazy. I already knew that it was going to take a lot of steps. Again, my degree is in kinesiology and exercise science. and I had done I've done internships with Texas Tech strength and conditioning program. So I had a base of, okay, this, I need to do this in periods. And how I did that was when it came time to start back walking, me and my wife would just take walks around the kitchen island. That was like my track. It was really hard some days because I was always tired. I wanted to lay down all the time. I wanted to sleep all the time. But my wife, she got me up and said, "Hey, no, we're gonna do this." So we would walk. And when I got to the point of being able to walk, for more than a couple minutes, more than 10 minutes, all right, then it's time to let's try to do this outside. And we went outside and okay, let's try to walk for 20 minutes. Okay, let's try to walk for a mile. So it started up. And I had to do that because I wanted to go back to school as well. So then at the end of 2019, I was like, okay, I'm almost ready to start back going to school. I really need to ramp this up. And we did the mile walk, and then we started doing the mile jog, me and my wife. And then we started doing the mile run. And so at the end of the day, it's my my love for exercise that is kind of added on to my treatment. And then nutrition. Nutrition is super important. I mean, I like candy and drinks and things like that. But with this illness, you really shouldn't be, doing any of that. So my wife is from Guam, so she's really big on the water and the eating right. So nutrition. And you got to make sure that's right when in your treatment. So exercise, nutrition, and then rest, sleeping really well, being on the schedule. For me, I'm very regimented. I do the same thing every single day. Me and my wife don't have any kids. That's also, I know a lot of people don't have the opportunities that we have as far as time. We're able to slot our time to do whatever we want. And we've kept our responsibilities low. So, I'm able to do with my time. I'm able to, I guess, slot my time around my treatment. My life is kind of revolves around this illness and making sure I manage it. And every single day I train. I'm all about training and eating right. So that's how I treat it.
All right. What about you, Janelle?
I would say the same for my husband. He is Tai Chi as very much a part of his life. So he's back doing Tai Chi, more and more of it every day. I don't think he probably would have survived this ordeal had he not been a practitioner of the martial arts in the past. It really gave him strength and some spiritual guidance as well, which is very important during this process. So yes, physical activity is very important. I think one of the key things you said is sleep. Because of the fatigue and the additional stresses on the body, he's got to have a lot of sleep. And so that's a very important thing that we make sure we make room for in our home is sleep and rest for him. Certainly some alternative sorts of treatments. There's been some acupuncture, which seems to help it sometimes. He's had frozen shoulder, which we've heard sometimes goes along with this. So he has PT for that. And I think also just keeping a very positive attitude. I know the panel earlier talked about anxiety and depression. And when you have all of these things happen, it certainly lowers your confidence, your health confidence. So trying to maintain a positive environment and having access to the physical rehab things as well has been very, very important and continues to play a big role in his life.
Thank you. Chris, would you mind sharing a little bit about, what you're doing to treat the conditions and symptoms and get through the day?
Well, currently I'm on Cresemba, and then tomorrow I go in for my monthly treatment of intrathecal amphotericin. So that's 3 to 4 hours on Wednesdays. I was doing that weekly. Now I'm down to a month, so fingers are crossed that we have limited appointments going on. But just getting out, socializing. I work 3 days a week at a local Nordstrom Rack. Everyone's got to love the Nordstrom Rack. They take good care of me with any questions I have or any problems I have with scheduling. So I work a Tuesday, Thursday, Saturday here in Scottsdale with them. I'm on the floor in shoes. And so my therapy is talking to people, customers. I have a number of customers that just want to come and talk to me. They want to see how I'm doing and just to see my positive energy. When I'm not doing that, I'm helping my mother-in-law, and then I'm walking my dog, trying to get in between 6,000 and 8,000 steps a day. Believe it or not, I used to be a frequent cyclist, and that's probably when I got the valley fever. I was cycling up to 150 to 200 miles a week. Now I'm just too scared to get on a bike because I have problems just walking. I don't know what would happen if I got onto a bike and tried to ride, and then with all my headgear, I just not ready to go that direction.
Thank you. And Susan?
Again, back to the posaconazole was key for me. But with my congenital heart defect, there can be exercise intolerance in certain situations. So what they had me do as part of rehab is a lot of just balance exercises that are less, what would you say, cardiac. They won't cause a cardiac situation. So I tried to do that. And I, on all honesty, should walk more than I do. But I'm getting around 3,000 to 4,000 steps, which is actually pretty good for tetralogy of Fallot.
That is good. Yeah, that you're staying active. Wendy, I know it's a little hard for us because we've been doing it for so long, but what are some of the things that stuck in your mind about what we've tried to do to deal with the side effects?
In terms of exercise and nutrition?
Oh, no, I was saying for Wendy. Sorry.
Oh, I'm sorry.
No, that's okay. You could answer.
I just think, the positive attitude has been the best thing that can overcome so many challenges. Our kids used to show livestock, and so just getting out and participating in events kind of sometimes takes your mind off of things a little bit and helps with that. Rob was lucky. He had fantastic doctors. He had Dr. Johnson and Dr. Haidari in Bakersfield. And, Dr. Haidari has always been so positive for him and for me even. And just, trying to eat healthy and move around.
And I would add, if you want to know what I really do to treat my symptoms, this is it. This is why I do that. This is my coping mechanism. And then if we can, I think Elijah is back. Yes. Can we add Elijah to the stage? Let's see.
Can you guys hear me?
Yeah.
Hey, Elijah.
Okay.
I don't see you. I hear
Okay,
you, and I'm happy to hear you. So what is it you're doing to kind of treat your condition and symptoms besides taking medication?
So for me, I take the fluconazole. For the longest time I was only taking 200 milligrams daily, and then I got sick and I saw some new physicians, and then so they just increased me to 400 milligrams daily. But for me, I've tried pretty much like every alternative therapy, medicine. Like, I'm not against trying anything. I'm a big fan of like acupuncture and dry needling. I've also tried like different therapies where similar to dialysis, where they take your blood out and then they oxygenate it and then put the blood back into your body. And I didn't feel like that was so effective for me, but I do know people that have like just raved about the symptoms improving and them having like really good outcomes and benefits from that sort of therapeutic treatment. But for me personally, I would say I would mostly agree with what DeMarco said about just increasing my fitness and my nutrition. Fitness is a big part of my healthcare and just what I do. So I'm a yoga instructor. I became a certified yoga instructor, and my primary care physician actually, in a way, I feel like he prescribed yoga to me, and he was because fitness was such a big part of my childhood growing up, and then I had the stroke, and then I couldn't walk, and then I was in a wheelchair for almost a decade, and then finally he was like, I think you need to find some mobility and some movement in your body, because I was just really stiff and I complained of a lot of aches and pains and just not being able to do much. So I went and started doing hot yoga actually. And I like just fell in love, and yoga has like honestly been life changing. And going back to like the mention of Tai Chi from Janelle, I feel like the whole spirituality aspect has like really been a big part of my recovery, and just like changing my mindset of just like woe is me, and like this is the hand I was dealt, and like how am I going to make the best of it. And so I feel like just like really changing my mindset. I recommend yoga to everybody, or whatever, like some sort of mobility. I know Susan was saying getting 4,000 steps like is really good for her given her conditions and things. And a lot of people nowadays, I feel like especially in the younger crowd, are like, you need to achieve like 10,000 steps. But I'm like, if you work and you have a life, achieving 10,000 steps is not manageable. So like make a goal, choose something that you can achieve, and like go after it. And whether it's yoga, whether it's 10 minutes of Tai Chi, whether you're getting 1,000, 2,000, 3,000 steps, like make a goal, reach it for yourself, and just stick to it. Focusing on nutrition, I feel like really controlling what you put into your body for how you want to feel. If you put in crap, you're going to feel crappy. I feel like I feel like more intention has to go into like the environment around me, and like what environment I put myself into. I have to put more thought into that than I feel like the average person does, because I'm already at sort of like a disadvantage because of my health situation. So, yeah.
Okay.
I love the determination that's coming out of this group, and your guys's, will to overcome Cocci meningitis and strengthen your body. I can relate to that so much. I'm a very competitive person, and even more so after my Cocci meningitis diagnosis, did I become more competitive, almost competitive against Cocci meningitis. Like, I'm going to show my body that I am more powerful than this disease is. So I love what you guys are saying. Just a follow-up question to what Rob asked. Do you have side effects from your medication that you're currently taking? And if so, what are those side effects? Janelle, maybe we'll start with you and your husband.
Sure. I will say, again, he's on the Olorifim treatment. Olorifim has been better for his kidneys. He seems to tolerate it much better, but there still are side effects. Gastrointestinal side effects, huge, and fatigue is still very evident. There's some things you can do to help with the gastrointestinal side effects, but they're not always effective. So, yeah.
And Susan, you want to share with us?
Sure. In fact, I would go as far to say that I have no side effects. And if anything, it's helped all of me. Because like I stated, my cardiologists have been following this so closely. And my heart has actually improved. And I'm almost 60 years old. So that's pretty good. And I had also GI issues. I had gastroparesis. And that seemed to resolve in conjunction with going off metformin on posaconazole. But fluconazole, none of these things happened, and I felt worse.
DeMarco?
Yeah, I don't think ever since I've been on posaconazole, I don't think I've had any side effects. I it's gotten me the closest to normal that I've felt since I gained or contracted Cocci. I think maybe the only side effect that that kind of annoys me is I think gynecomastia, is that part of the posaconazole? Is that part of it? I think that with all the
Yeah.
with all the medications that I'm taking, just that the formation of that. But other than that, no, that's it.
And Wendy, do you want to tell us a little bit about Rob's side effects?
Well, I think the thing that we struggle the most with now is more because of the sun sensitivity from when he was on the voriconazole. I think that was the right one. He, every several months, he's having to go to the dermatologist, get things frozen off. I think that medication, because we were, outside a lot. We had property, we had animals. Our lifestyle was outside. And so that really played an impact on things now that are still, even though he hasn't been on that for, 8 years. I'm not sure. It's been a long time. There's still, issues with that. So that's probably been our biggest struggle.
And Chris?
It's hard to say if it's from the medicine or just the actual disease, but the brain fog, memory issues, profound fatigue, my tremors in my hands have gotten worse. And now the tremors have moved into my mouth with my tongue and my teeth. Fine motor skills, balance issues, and the two funnest ones, bowel and bladder issues. Those are just, they're not fun to treat and they're not fun to deal with. And difficulty regulating my temperature, which is very hard here in Arizona. I'm either really hot or really cold, but most of the time it's hot. So everyone else around me suffers.
I'm seeing all the head nods. We're all relating to what you're saying. And then Elijah, anything to add to the conversation?
I think for me, like the biggest things that I notice with my medication is just like fatigue and nausea and just like constantly feeling sick. I think for the longest time when I started taking my medication, I was like, well, I'm already sick and the medication's making me sick. It's not helping. And I was like, so I'm not going to keep taking it. And then it got to a point where I ended up getting worse. I ended up back in the hospital and having to do amphotericin and doing rounds of that. And anything is better than amphotericin, honestly. So I think for me, just the biggest issue. But now I just don't know if like the medication makes me feel a certain way. And then my hair was falling out. And then like I was adjusting to like the dryness of my skin. And now I'm just kind of like at a baseline. So when people ask me, they're like, how sick, like, are you sick? And I'm like, well, I'm already like kind of already like at a 3 or a 2 for like the average person. So I'm like, that's where my 0 is. So like for me, I think mostly I just deal with a lot of nausea and just like not wanting to eat. And especially depending on when I take my medication, if I don't eat breakfast immediately after, then like the rest of my day, I'm kind of like, ugh.
Yeah.
So for everybody on this group, how has your clinical treatment regimen changed over time? Like what the doctors tell you to do, how's that changed over time? I'm going to ask Chris, would you mind starting that discussion this time?
Well, clinically, I see Dr. Grill, which is an infectious disease neurologist, and Dr. Blair. The neurology team I see twice a year. Dr. Blair I see every 3 months. And I saw that Dr. Donovan's on here, so hello. As I used to see her in Tucson, I would make the trip down to see her. But nothing has really changed. It's still checking in, doing the blood work, and going from there and seeing where we're at.
Have they changed what they've prescribed you at all?
No, we're still on Cresemba. We're on 2 Cresemba pills a day.
Plus
and plus the amphotericin monthly.
Were you started on Cresemba?
No, I was starters on fluconazole, and then I progressed through all of them. I went through the first couple, then went to posaconazole, then went to Cresemba, and then I think the prescription was messed up, got really sick on that, went back to posaconazole, and then a year ago, I think, I went from posaconazole back to Cresemba. And I've been on that for a year. And that's challenging with insurance too, because they challenge why I need to be on it and why I can't be going back on Cresemba, or excuse me, going back on fluconazole.
What about you, Janelle?
Clinically, I think it's never linear, and there's always changes. From the cardiac arrest, certainly we've dealt with cardiologists. It's the nephrologist, because of damage from the early use of the posaconazole and the fluconazole. We're the neurosurgeon on a regular basis for the VP shunt, a neurologist for balance and other issues, urologist, of course, because we know that it also affects that part of the body. So I would say clinically, it's really trying to manage them all and bring it all together, which is a big issue. Does the cardiologist, are they in line with what we're doing for the Cocci? Of course, we're Dr. Donovan, we see on a regular basis as well. His treatment changes through time also. There was a point when he did choose to go off of olorofim, or try to, but then decided that that wasn't the case. We needed to stay on it. Because of the need for the VP shunt. So it's always really trying to figure out what to do now and what to do next, based upon symptoms, based upon test results. It always changes. And I think one of the things I will say, Wendy, too, and all of you and your spouses and your caregivers, I really don't know how anyone could manage this disease without having someone to help them, an advocate to help them, because there are so many pieces of the puzzle that you have to pull together. So many questions. I mean, that is typing here, all these questions we still have. Really working together as a team is really so important. And when you've got great caregivers, physicians, it really helps the process as well. But it's a process, for sure.
Susan, what would you say?
So
how was your clinical treatment regimen changed over time?
So in the beginning, when I was first diagnosed, I was going in very frequently, like once every month or two. And then when I switched over to Dr. Galgiani, he managed to get everything under control really well. And again, because he looked at my heart issues and could speak with my cardiologist, everything's kind of lined up, which is a miracle. So now I'm at the point, after somewhat about 4.5 years out, where I go into cardiology, thank God, only once a year now, and Dr. Galgiani once a year, unless there's a problem, which there has not been with the brain or the heart. So I feel like I'm very fortunate.
Yeah, sounds like it.
Yeah, it's a miracle, really.
Oh.
Wendy, do you want to try and answer that as well?
Well, for Rob's treatment, it started off the fluconazole for a while. That didn't work. He went, I believe, another azole before the voriconazole. I think posaconazole is his fourth. But when he started the ampho, it was 2 or 3 times a week that he was on the ampho. And he started to have a lot of the same symptoms, Chris, that you were describing. The urinary issues, the not being able to walk, those kind of issues. And they did run a bunch of tests and his numbers, all of his titers were very stable. And so they were able to start weaning him back off the AMPHO. And a lot of those symptoms went away. And I mean, it's been a really long time. He was diagnosed in 2012. But now I believe it's been a year since he's had an AMPHO treatment. So stay positive. There is a light at the end of the tunnel.
Thank you for that great news. Thank you.
You're welcome.
What about you, DeMarco?
Oh yeah. So for me, I'm on the. I guess I'm on that far end where I have seen the light. In the beginning, it was really tough. 2017 till through 2019 was the time that I was on the voriconazole, the fluconazole, the amphotericin B, and all that stuff. But again, once my doctor moved me to posaconazole, things started really getting back to normal. So now, so it's been 9 years, and we've lessened the doctor's appointments to about probably I see my ID doctor once a year now, and that just started last year. And then the medications I've kind of I'm kind of not, I'm not gonna wean, we're not weaning me off of it, but we're taking less dosages. All right. And the medications that I take are posaconazole, and then I had one seizure, so I'm taking levetiracetam as well. So and they've kind of they've went down on the dosage with that as well. So for me, I haven't had any I guess relapses or anything like that. So now is okay. How low can we get the dosage to where where he's still being managed? So I guess I'm more of in a managed phase, and I'm dormant, and so I'm doing very well.
And then Elijah.
For me, the way that my treatment has sort of changed is I was probably going to the doctors like every month in the beginning. I'm trying to think, I did amphotericin, I did like for a month in 2016, then I did another month at home healthcare in 2017. I'm trying to think. And then the last time I did amphotericin B was in 2024 when I was in the hospital again for another month period. But I've only mostly just done the fluconazole, and now I see my infectious disease doctor about every 6 months. She's like constantly testing me for anything and everything under the sun. She's like, make sure you don't want to get any other infections. I'm like, well, I'm not getting anything else. At least I hope not. But I just mostly take fluconazole. I used to take, I think I was taking 1,600 milligrams in the beginning, which I hated, which is awful. They reduced me down to 800. And then I finally worked all the way down to 200 milligrams. But then after the last time I was in the hospital in January 2024, they were like, we think you need to stay on at least 400 milligrams to effectively treat your condition. So I've been taking 400 milligrams since, and it was a little rough to go from 2 back to 8 down to 4, but like now it's just kind of where I'm at, and it is what it is. So yeah.
Well, and another thing, another important thing is every 3 months I get labs done, and that's also helped with managing all of this as well. So I forgot that in my whole spiel, but constantly getting labs
Me too.
has been life-saving. Yeah, that's important.
Yeah, for sure. And I don't follow up with a neurologist, but I do get Botox injections on my left foot because I have like spasticity and issues with walking, so they kind of help me use my foot a little more. A lot of people think it's really interesting that I always get Botox injections, and they're like, you're too young for that. And I'm like, well, no, they do other things too. But yeah.
Well, much like it sounds like all of our diagnosis was a journey, treatment is also a journey, an even longer, potentially lifelong journey. And we've all, seems like, been on at least 2 different antifungals to try to address our disease. Another key that sounds like comes from this conversation is a very invested infectious disease doctor. I adore mine. He's available at my beck and call, and I usually have a whole list of questions that I'm asking him at every appointment. But can you guys each just summarize for the viewers how many antifungal treatments have you been on since you were diagnosed, or the person that you are taking care of was diagnosed with Cocci Meningitis? For me, I've been on 2, and I found my magic spot. So Janelle.
Okay. Let's see. My husband was on posaconazole, fluconazole, and then went on the olorifim investigational study. If the gentleman from the FDA is still on this call, I implore you, I plead to you, I beg of you, please continue these studies and approve this drug. It can help so many people. And there may even be indications that it's cidal, and eventually maybe people will even be cured from this. So please, please, please approve olorifim, please.
Well, and the purpose of this, Janelle, is to help the FDA understand how to measure effectiveness for a drug like olorifim.
Right.
And so that's one of the big benefits that's going to come out of here. So
great.
And there's multiple members of the FDA listening. So
great. Well,
Susan, can you summarize for us your number of antifungals?
Sure. I've been on 2, and the first one was fluconazole, where, as I said, over time I started to have bradycardia and could potentially go into heart failure. With tetralogy of Fallot, you don't want anything to do with any kind of heart failure. So I've been in heart failure twice in my life, very severely. And I just want to give a general statement that congenital heart defects are the #1 birth defect in the world. But yet with studies such as this, I feel it's always an afterthought, whereas there are a significant number of us out there. And also because, as mentioned earlier, itraconazole can cause heart issues. I mean, it really limits my options. And voriconazole is a no for me because I've had cancer twice. So that's not an option. So posaconazole is my only option right now. And I just wish that they would work with insurance companies to make it available. And they're always questioning my doctors because they have no clue what tetralogy of Fallot is or Cocci Meningitis. So he's trying to explain 2 situations that really the people in the insurance companies are not trained to understand. They're very rare, but for me, it's life-saving. So, and another thing I would say is that we're not just statistics. As you hear everyone speak, we're all real people with real situations behind these numbers, because everything comes down to numbers. And I wish they would look more at the humanity of the situation.
Thank you.
And not to mention just what Susan was saying, trying to talk to these people, they're all on the East Coast. So they have no clue about anything that's going on the West Coast or what is Cocci Meningitis.
That's right.
Elijah?
For me, I just the Ampho in the hospital and then fluconazole when I was at home. Fluconazole is the only medication that I've taken. And all the infectious disease doctors have talked about taking something else, but they all have pretty much said that they think fluconazole is the best, and that at least the ones that I've seen, they're like, this is what's working the best for you. So they're like, let's just stick with it. And, yeah.
All right, Chris.
All the antifungals available, and now on Cresemba for a year. So we think we're staying here. And I only have 3 appointments left of the amphotericin B. So we hope that. And we did try the olorifim, but that didn't sit well with I think it was my liver.
Oh. And Wendy, for Rob?
So Rob's been, I believe, on 4 fluconazole, itraconazole, 05. Sorry, my bad. Voriconazole, posaconazole, and one other azole that I don't even remember.
Amphotericin.
Oh, well, that one too, obviously, with the reservoir there. Yeah.
And DeMarque?
Yes, ma'am. For me, amphotericin V, voriconazole, fluconazole, and posaconazole. So I believe the 4.
There's a lot of antifungal experience in this group right here.
Yeah. So next question is for me. How well does your current treatment regimen treat the most significant symptoms of your disease? How well do you feel like your current treatment regimen is working? Let's start with Elijah this time.
I feel like it's as good as it's gonna get. I mean, I still have like deficits, and I think that like what I had to accept for the longest time was that I'll never be the kind of person or the person I was before I got sick, and so like for me it's very different because like I got sick during that time period of like transitioning from like being a quote unquote kid to becoming an adult. So like there was a lot happening, I guess, like in my developmental period and in my life that like my family oftentimes for the longest time was really hard for me to accept. And they were like, you're not the same person you were. And then for the longest time that was really difficult for me, like because I was like, I don't know how I changed, and I'm sorry that I did because I didn't want to, I didn't mean to. But I'm also like, and it was in a period where I was turning into an adult, growing into a new person. And so I'm sorry, what was the original question again?
So the technical question was, how well does your current treatment regimen treat your symptoms and your disease?
So I feel like my current regimen, I feel like it, like I said, it's just the best that it's going to get. I feel like there could be better options. I feel like some of the side effects are a little rough. I feel like as far as like how well is it, like on a scale from like 0 to 10, like I'm satisfied with maybe like a 7 out of 10, 10 being the best. Like I feel like there are worse options. I feel like I'm managing and I'm able to live my life mostly as fulfilled as I want it to be. But I feel like there could be better options.
DeMarque? How do you feel that your current treatment's taking care of your disease?
Well, on a scale from 9 to 10, from 1 to 10, I'd say a 9. I'll say a 9. I mean, there's always room for improvement in anything, so you can never really give anything a 10. But I'm so focused and locked into my regimen that I feel like my treatment's going pretty well. So yeah.
Susan?
Yeah, I think I'm doing incredibly well, actually. So I would say 9. And again, I wish there were more treatment options. I think it's vital because everyone's in such a different situation. You need something that is specific to that one person that works. So you can't just have a one-size-fits-all cure.
Exactly. What about you, Janelle?
I think my husband is doing fantastically well. I'm very proud of what he's overcome. Elijah, like you, even a 65-year-old man is dealing with the fact that he's not the same, and it's a very difficult realization and hard to deal with. So I feel for you. How well is he doing? I think the answer is, how well is he being treated, or how well is the treatment doing? I think the answer is, we don't know. He seems to be doing okay, but could he be doing better? Could different drugs do a better job? There's so many questions with this disease. With the shunt, how well will the shunt do? They say, 50% of the shunts have failure. He hasn't had a failure. Will he have a failure? How will that be treated if that needs to be replaced? What will happen then? So right now, today, he's doing pretty damn good. We're very proud of him, but there's so many questions. And we still need so many answers.
Okay. Chris, how would you say?
I think it's a flip of the coin on the day. Some days there's good days, and some days there's rough days where it's a struggle to get out of bed and to get going on anything. And then I have to go back through and recheck and check my medicines to make sure I'm all current on them. I mean, with so much brain fog and so much going on, I do forget to do things. And medicine is one of them. So I have to make sure I monitor that to make sure everything, I leave my Crescemba on the counter at night opened, so I remember the next morning that I took it the night before. And I have an alarm on my phone to take it every night before I go to bed. So, that's a hard question to say.
So I'm not going to ask Wendy that question just because I don't want to. But so I mean,
I could elaborate.
So
I do know for the memory thing for taking the medication. I know Rob does a pill container with the days of the weeks, and there's the AM and the PM, and so that way he definitely knows if he took it or not. I don't know if that would be something that would be beneficial for you.
So we have about 10 minutes left and I'm hoping we can squeeze in 2 quick questions. So for those 2 questions, I'm going to turn it over to Bryn.
Right. So the next question is, what are the most significant downsides to your current treatments, and how do they affect your daily life? So Chris, I'll kick this one over to you to start with.
Well, the downsides is I went from weekly amphotericin to now to monthly. So that's fabulous. And that's a great downside to have.
And Wendy, anything about Rob's treatment?
I mean, it's just, there's not really, just the only downside is the effects from the voriconazole, the skin issues and having to be rechecked all the time for the skin cancer. I think that's right now our biggest obstacle for us. He's been very lucky and he's came a long way. So yeah, I think the side effects from that medication are still ongoing.
Janelle?
The downside in general is that he and all of you have to be on any sort of treatment, and that this crazy disease exists, and that there isn't even better treatments for it. So, he's dealing with all of the treatments, and he's happy that he has access to the Olorafim and the wonderful care that he's getting. And we wish we didn't have to do it.
DeMarque?
Yes, ma'am. The downsides, I think, are just as Janelle said, is that we have to take anything. My issues with memory issues, they kind of gets annoying. My wife gets annoyed with it. She kind of always poking and prodding me about my memory, calls me an old man and all that. So probably the memory issues, and then again, gynecomastia, which isn't so bad, but for me, but I think that's about it. That's the only downside that I have.
Elijah, any downsides for you? Okay, we might have lost Elijah. And Susan, how about for you?
So I would say that there's 2. One is just finding the right doctors. Outside of these 2 conditions. It's been so challenging. So that's the first one. And then the second is trying to get posaconazole renewed every year. Because Dr. Galgiani's been a saint for what he's had to do to get me on the med and to keep me on the med, because insurance, again, it's just been such a hassle. And every year I get such anxiety just thinking about it, that if they were to deny me when it's really my only option. So that is my biggest downside.
Yeah, and you and I have had this conversation
Yes.
before, but I
Yes, we have.
totally relate to that.
Yes.
You know, I can't get fluconazole approved through my health insurance anymore. Even though I have demonstrated I've failed on fluconazole, it is the only antifungal treatment that my health insurance will approve. And luckily, my infectious disease doctor has helped me become very creative in accessing the medication. That it is very expensive, but we've had to do just that, work together and get creative to access it. And that's very unfortunate that we have to do that.
Yeah, it's not, I don't think that's right at all, because if there is something available that can help you, you should have access to it.
Absolutely. Absolutely. All right. Well, we'll move into our last question. And that is, short of a complete cure, which I think we all wish was there, what specific things would you look for in an ideal treatment for your condition? And Susan, we'll start with you.
I guess to get a little more energy would be nice, and to somehow fully work out the balance so every day is a good balanced day. Although lately it's been much improved by quite a bit, but it would be nice to wake up every day knowing I had energy and I had the right balance.
And Janelle, what would you say to that?
I would agree that my husband would say the same thing: balance, energy. As his wife who looks at this, obviously the cure, as you mentioned, but treatment that addresses not only the Cocci Meningitis, but other effects from the Cocci Meningitis, like the arachnoid fibrosis, because that's what made it necessary for him to have the shunt. And that would now keep that at bay and keep him from developing any future arachnoid fibrosis, whether it be in the spine or other areas. Again, that's an unknown. So being able to know that that could be stopped and that there wouldn't be any future progression of that.
And Chris?
Of course, the better treatment, but the balancing and the energy and less side effects from any kind of drug. Because now, like Janelle said, I'm with the urologist. I'm seeing the neurologist. I'm a regular at Mayo. So I'm seeing every group, luckily for me, that they all talk. And I'm a topic of conversation at lunch. So just having better drugs with less side effects on the rest of the body.
Yeah.
And Wendy?
I think that, we're lucky we're in a pretty good spot. So he got great treatment in Care Medical. I think as of now, my wish for everybody is a awareness and a quicker diagnosis for everyone.
Love that. Marquay?
Yes, ma'am. And I'm the same as far as I wish for just more awareness. I'm being taken care of by the VA, which is crazy. That's not I guess a normal thing. There's always horror stories with the VA. But as far as everything that I could possibly want in treatment, the VA has provided, especially with this disease. I do a chiropractor. I've gotten access to fluconazole at a very early point. I get my labs taken every 3 to 4 months. I have eye appointments, podiatry, all that stuff is all added into one. So I think access to all this treatment, I want everyone to get, and I want everyone to have awareness of it. And to have the outcomes that I have had, or get on the same road that I'm on. I would love that for everyone. Yeah.
And then Elijah, are you back on the line with us? Not hearing him. All right, Rob. Oh, go ahead, Janelle.
I just wanted to add one thing. I think also, we've all heard about the vaccine for dogs. We want a vaccine for humans too. That would be my biggest dream, so that no one else in the future has to deal with everything that you guys have had to deal with. A vaccine.
An ounce of prevention instead of a pound of cure.
Yes.
Yes. I love that.
Great. Thank you, Janelle. That's a great transition, because the next person that we're going to actually have, and if we can throw the slide back up to introduce. I have somebody that's going to give us a summation of the meeting, and I'm happy to introduce Sarah Wicks from Hyman, Phelps, and McNamara to kind of give us a summation of the meeting from her perspective. So we're going to turn it back over to Sarah. It's going to take a second to get everybody off stage, but there you are, Sarah. And you're muted for some reason. It's still showing you're muted. So let's do this. Let's flip it around. So sometimes what happens is when you log into the participant panel, it blocks your sound or your camera. So I may need you to log right out and log right back in. And then we'll just do that real quick. And then while we're doing that, I'll kind of tell everybody what happens next and talk about that. And that'll give you a second. And then we'll just kind of flip that around if that's okay. So if we can throw the slides back on. So obviously we want to hear from you. So we're going to continue to do some outreach as far as documenting treatment experiences. We have about another dozen patients that we're going to be reaching out to capture their stories in depth, like we captured yours. We're going to be doing some follow-up surveys and maybe a few questions. And the goal is to, shape future solutions. But what's going to happen next is, after all that, then we go to what's called the Voice of the Patient report. The Voice of the Patient report allows us to share an overview with a great amount of detail, and also a great amount of detail with the FDA. And along with sharing it with the FDA, this is a public report that's available to industry and researchers. And the goal is that will be used by drug developers and vaccine developers to work with the FDA to design clinical trials to get the drugs that we've been talking about to market, as well as additional ones. And, so that's what we're going to be working towards. And then while we're getting Sarah back in here, we are going to want to take a second to thank you all for everything that you've done. And then I'll let Sarah give her summation. Can we move Sarah back on the screen?
Microphone. Okay.
I think I hear you, Sarah.
Okay, let's try again. Now let me do my video. How about now? Can you hear me now?
Yes.
Okay.
Best for last.
All right, great. Thanks for the tech help just now. So for the meeting summary, thanks, Rob, for inviting me to provide the meeting summary. The meeting today opened with remarks from co-moderators Bryn Kerrigan, Director of the Kern County Department of Public Health, and Rob Purdy, founding member of MyCARE, who offered both professional and personal perspectives of living with CNS disseminated Coccidioidomycosis, or Cocci Meningitis. Dr. Peter Kim, Director of the Division of Anti-Infectives at FDA, shared that this meeting will give the agency direct insight into what it's like to live with Cocci Meningitis, which will inform FDA's thinking throughout drug development and review, shaping what outcomes are prioritized and identifying what benefits are meaningful and what risks are acceptable. We then heard from Dr. Geeta Siva Subramanian, Associate Professor of Medicine at UCSF, who shared that Cocci meningitis is a rare, serious, and often life-threatening complication of infection with the Coccidioides fungi. Infection typically begins when spores are inhaled from the environment, most commonly causing a lung infection. However, in a small subset of cases, the infection can spread to the central nervous system, sometimes within weeks of initial infection. The disease is most
And at least on my end, it looks like it may have, yeah, she dropped off. I want to add something to this. In case you're wondering why Sarah is giving our summation and who Hyman, Phillips, and McNamara are, or Phelps, excuse me. So Hyman, Phelps, McNamara is a company, an organization, a law firm based in DC that works with companies to develop drugs. And they sent out a newsletter that is almost daily, certainly weekly, called the FDA Law Blog. And so they have a lot of experience and knowledge in working with the FDA and a lot of great perspective. And so we wanted to include them as well. So they are in a very unique place. They're one of a handful of companies, organizations that do this. But I want to kind of plug the FDALawblog.com. If you guys want to know what's going on at the FDA, it's a great way to do it. Some of it is very relevant to what we're to us as patients, and some of it is, quite frankly, the most foreign language you've ever read. But it is an amazing thing. It is great knowledge. So again, I think I want to put up our last slide to thank you all again. We look forward to some potential follow-up discussions with you, some clarifications to help build this voice of the patient report and help us share this with the FDA, with researchers, with industry to ensure that our voices and our perspectives are at the center of any future efforts to approve new drugs. It's a very important thing that you guys have done today with the time that you provided us, and hopefully, well, not in the short term, we will see long-term improvements for everyone that we care about. So thank you all for your generous time today, and we look forward to sharing additional information with you and additional communications with you over the next short and long term. So with that, I would like to say thank you all. I would say internet is back, and she has some additional remarks that we do have a couple minutes left. Just kind of filling in the gap. She would do a much better job than me of sharing that. So it does not look like that. So I think we will do something that is nice. And I'd like to invite Bryn back on for just a second. Bryn, is there anything that you would like to add as far as closing remarks or comments?
I think just very much the same thing that I said earlier. I'm just very honored to be a part of this and to be able to hear the stories that you all so vulnerably and willingly shared. This is going to be instrumental in us progressing treatment available for folks with Cocci meningitis, and just us talking about our stories and sharing the detrimental impacts that Cocci meningitis has on our lives perhaps will help people protect themselves from valley fever. So thank you so much. I just really appreciate being able to be a part of this.
Well, thank you all for your time and participation today. we look forward to future interactions and abilities to work towards creating this Voice of the Patient report. So thank you all for your time today. Have a wonderful afternoon.